Не, я ей на всякий случай кажу, знаєш, тому що вона потім з лінійкою там сидить міряє.
Надзвичайно приємно вітати всіх наших гостей, які знаходяться у залі і які знаходяться.
We welcome all our guests who are here in our audience and behind the screen as well, because the format is interesting. First of all, it's very pleasant that finally, after COVID, after pandemic, still we have now people in our audience. So let us give a round of applause to each other. It's my pleasure to see you all, and it's wonderful that thanks to the modern up-to-date technologies, we can join and unite different parts of not only Ukraine, but different countries are getting together today to share this wonderful marathon together with us, to be with us. So dear friends, what's going on today? So this is a marathon of victorious clinical cases. Of course, we are going to overcome different diseases. So in this auditorium and behind the screen, we have aesthetic medicine specialists, experts, and today we are going to have high-level experts, people who are going to share their real clinical cases. And of course, we are going to have discussions of those cases today. On the 24th of February, the world has changed forever, and Ukraine's never going to be as it was before. It's never going to be the same, just like as the world in general. And many people have suffered, and they required aesthetic and cosmetic care on top of medical care as well. So HYALUAL are providing care to around 100 patients free of charge, and we are going to share these cases with you. So these are 100 winning beauty stories, and the patients are getting free of charge care and support. And today, 10 experts are going to present incredible cases, and they say that 100% beauty and kindness and generosity will win. And lots of different stories are waiting for you today, dear guests and friends here and behind the screen. And of course, you will be listening to that. Maybe you would like to jot it down somewhere in your notes. So, and you will combine both pleasant things and useful things, getting useful information and receiving great pleasure. So in order to officially start our today's conference and to launch this event, I would like to give the floor to the director of HYALUAL in Ukraine, Mr. Alexander Nikanul. Thank you, dear friends. I'm happy to welcome all of you at our victorious marathon. I would like to welcome everyone who is here with us, and everyone else who is online, has joined us online. And I know there are lots of us today, and this is a special time that we are getting together. And as the founder of our corporation has mentioned, Mykola Ivanovich, he has said that life is the most precious global value, and that's true, and we will see that it's like that. So I wish you the fruitful, productive day, good impressions, and a round of applause to all of us. Thank you very much. Thank you for this official opening, and dear viewers here and behind the screen, you'll be hearing our experts, and of course there's going to be questions and answers. There'll be time for that. Couple of household issues for everyone to understand. Lots of more people are joining right now in YouTube, so it's free of charge that you would be able to share this link to this conference to other people, in order for everyone else who is actually involved in what we are discussing today to be able, for them to be able to see, to view the conference. So you're most welcome to share the link if you like it, and I'm pretty much sure that you are going to like this marathon cases, you can write about that in Facebook, in Instagram, no problem, you can do that. Please tag HYALUAL, and you can post pictures, photographs, you can make selfie, how you view the conference. So whatever you wish, please, you can do anything. And today we have a certain timeline, of course. It's like each conference, every conference has, so we will try to keep on time. Of course, we will have time for some questions to answer from the audience if we get them, and a couple of questions from our viewers behind the screen, the online viewers. So please ask your questions in our chat in order for our moderators to be able to filter them, to choose the most interesting, and I would ask them, put them to our speakers. But again, still there'll be more questions to answer, and our speakers will find more time after the marathon to answer. So you will get the answers eventually. If not today, then later. And I've mentioned that we are being viewed from different parts of our planet, from different countries. So just a little announcement. We are happy to welcome people from Kazakhstan, Lithuania, Azerbaijan, and other countries. And of course, you have the opportunity to turn on the subtitles in the language that you might choose. Maybe you will need that, but it seems like more and more people who've never understood Ukrainian language before, now they start to understand that. So how do we go about the subtitles? So setting icon, and then you choose subtitle, translate, and then you choose the language that you require. And those who've registered in Russian, we will send you the recording with translation. You will get it for sure. And I will say it in Russian. If there are any problems with the language, if you don't always understand Ukrainian language, you have the opportunity to switch the subtitles to the language that you require. So it's settings, subtitles, and then you choose the language that you require. Those who've registered in Russian will get the recording with the translation later on. So thank you that you're with us today. It's very pleasant to feel this energy that our viewers irradiate, and everyone is smiling in this audience. So yes, it's been a long time. So it seems like in the city of Uzhhorod, it was kind of easier to hold some events compared to the rest of Ukraine. Okay, so officially we will start communication with our speakers, and it's my greatest pleasure to invite our first respectful speaker. This is the plastic reconstructive aesthetic surgeon, Lita Plus Clinic founder and owner, Darbak Serhiy. Thank you. Thank you. Hello, everyone. I'm happy to see everyone here in this audience. So this audience is almost full. It's like a flashback. I don't remember when it was the last time when the audience was so full. My name is Serhiy, and I'm into plastic surgery, and thank you to organizers that they found this fantastic location, this wonderful, well, actually, this is the utmost Western event hall of Ukraine. So maybe about 200 meters from here, we have the border with Slovakia. So thank you that you have found such a safe and nice place for us to get together, to look into each other's eyes, to talk about what we are into now, what we are going to do in future, and finally, what are we going to do further on? How do we work? What do we do with our fantastic patients and the patients who have now were added to our practice? So my presentation is going to be about that. Of course, I'm going to show you a couple of cases. This is not a surgical conference, I realize that. So I tried to take some patients, those patients who've had some cosmetology, surgical indications. So I believe it's going to be interesting for you. But first, I would like to talk a little bit about the status of aesthetic surgery, aesthetic cosmetology now, and where we are now. What's this place that we are at now? Because if we compare to what we did before the war, of course, the concept was different. If we say and if we talk about our patients before the war, those were different patients. Of course, our patients are with us, but also other patients have added. For example, my work, 99.9% before the war, was like this. Those were cases like that. Beautiful women, nice people, a person comes to you and she needs a bigger breasts to get rid of the eye bags, bigger lips, bigger cheekbones. So a healthy person comes to you and she needs some improvement, and you are just like a Superman, you are so tough. You take this syringe with a fantastic thing like HYALUAL product, and the person right away leaves your office with wonderful changes of her or his facial contours or skin quality. It's fantastic. Now we understand that, we realize that, because the new realities, new patient realities allow us to understand that today we cannot promise anything specific to the patients that we are starting to get now. Before the war, in my clinic, for example, there were some exceptional cases, maybe one patient a month who used to come for reconstruction. But now in our clinic, we always have patients requiring reconstruction, some mutilations, some injuries due to the war activities, the hostilities, and the peaceful population, people and military personnel all come with some injuries to the body, to the face, and this is the new reality. When I used to be a Superman before the war and I used to get a healthy person in my office, I was able to promise, but today I cannot promise anything specific to these patients. Maybe a little one slide back, because you cannot promise anything to patients like that. Psychologically, it's the most difficult story that we are going to live with, and we are going to live with that for many dozens of years. We are going to try to get rid of the consequences of the war. So please remember this face, this woman. We will be talking about this woman today, and we will be talking why it's going to be our job for dozens of years ahead, working with such patients till the end of our practice, probably. Because such patients we do have a lot now. During the first months of war, I was thinking, where are these patients I was expecting? Because we are reconstructive plastic surgeons, dermatosurgeons, dermatotherapists. We are the tertiary level of care specialists. We cannot help them on the primary level of care at the time when they got the specific burns or injuries or wounds. This is up to the primary care level, and we start to get them months after that. So now 3 months has come, and now I see secondary deformities of the facial contours and body contours, and every day more and more patients start to come, and now I understand it's going to be for a long time. Coming back to the idea that the main problem of mine is that I cannot promise anything to these patients, because the patient who comes healthy, well, yes, you promise and you say in a month you're going to have wonderful breasts, or in 2 weeks you will get an excellent result after a blepharoplasty. And is speaking about the patients who come after the war injuries, their expectations are the same. They want to get back to the same facial contours or body contours that they've had before the injury, and let alone lost limbs, for example. But so they want to get back functionally to the previous state, and we cannot do that. Even if we are as good as we are, unfortunately, we will not be able to get them back to the point they were at before. That's the most important problem, and that's a challenge. We always have thought that we've always had a fantastic experience, but now it's more difficult. And I believe after this story, this whole story, when it's over, hopefully very soon, we will probably get a new direction. And during all the conference, we are probably talk about some military dermatocosmetology direction or specialty. And I guess some guidelines will need to be developed, because now we are improvising. Nobody knows how to treat burns with phosphorus or secondary damage due to phosphorus. You just come, get the patients, and you try. And something works, something does not work well. So I hope the HYALUAL Institute is going to help us in that, to develop the guidelines to treat patients like that. And now I would like to show you a couple of cases. The patients who have suffered, this girl didn't suffer due to war, but still we are going to get more patients like that. This is the patient that I've been dealing with for about 2 years, a small girl who had a burn with a burner. So there was a picnic, and this child was running somewhere, and something happened, so that the burner spilled on her and she got burned. And it was not only the face, but the whole body burned in this girl, and it's quite relevant. So we'll be showing what we did to the face, because there is the whole complex of problems here. There is a problem of hypertrophy, and of course this patient, and when such a patient comes to a plastic surgeon or dermatocosmetologist, it's the patient who has underwent many levels of care.
So the patient has been in coma, was intubated, then would have some bed sores, stroma, etc. Now, at the moment, the patient is quite functional and pretty healthy, been treated by combustiology experts and burn experts, and the lady is at home for about a year. So this long-term hell is almost over for the family and for the child, and definitely the parents are not happy with the current situation, because the face looks pretty asocial, and definitely the child wants socializing, and that looks like a rather comprehensive request, I would say. That means the parents, who are usually the best dermatocosmetologists, they actually want to be involved. I think they gave me many more advice compared to the whole series of conferences I have attended. They know all the sites, they know all the facilities, they know all the experts available in Ukraine, and they're really the very good source of knowledge about this topic. So when we got down to this child, when we started working with the child, we saw she would have a lot of artificial skin. Only the periorbital area was quite intact. Glabella, nose, just a bit of around the mouth. The rest was skin grafts. And that was actually a big problem, I would say, because we thought it could be possible to take some skin grafts from the neck, but it was not a good idea. And we saw there was some contracture, extrapion of the lower eyelids, and these scars, they actually were a big problem in multiple areas, including cheeks, eyes, eyelids, etc. So we decided to, based on our own decision, we started betamethasone Kenalog injections under anesthesia. It took some time, actually. After the scarring, actually, and the scars only enlarged, so we realized we had to make many more interventions, and we used rather aggressive medicines for the child. It actually gave good result after a couple of injections. So the difference between these two photos is about 11 surgical interventions and cosmetology manipulations. It took about one year period of time, like 11 narcosis cases, narcosis times. We have a good doctor from Ohmadid Pediatric Hospital who is capable of giving anesthesia, proper narcosis to children. At first, the child is quite afraid, of course, of this, mask, but then later, the child is fine. So betamethasone injections, lipofilling, various types of them have been used. Some local surgical plastic interventions, incising these deformations all around the mouth, especially close to the depressor muscles. That was actually a big functional problem for the child, associated with the intake of food, by the way. So we had to incise these scars, as well as we had to go to the cheeks and we had to incise these internal scars. It was not easy, actually, to remove these scars completely. So we decided, because of the deficit of skin, we decided to go from internal side to remove the profile of it, the projection of it. The child has been wearing a special mask for a long period of time. There was some skin grafting procedures performed, and pay attention to the skin now. One of the big problems, the children grow, they develop pretty quickly, and she would have quite a number of contractures leading to problems with the neck, etc. So basically, if you look now into the most recent stages, right before the war, the active war started, and we compare the left to the right, we see this is the result of almost like a year and a half activities and 11 interventions under narcosis. Does it look good? Well, yes. At the moment, we can say it's not bad. Is it good enough? It's not yet good enough, definitely. So basically, these are the patients who come for reconstructive surgery, and definitely they will not be as happy as those girls that come for lip surgery or lip enlargement. They are definitely not as happy as those are. But still, if you look into what it was and what it is really impressive, and she is really on a good path. I think we will continue our interventions because we have some big plans ahead for this young lady, and definitely we need time. We need time, definitely. This kind of burns problems in children makes us limited in time. You cannot do much. You cannot do many manipulations at the same time because sometimes you have to wait until the child grows and then you get down to some radical interventions. One could use PRP injections. One could think about collagenase, etc., etc. Some other complex and comprehensive approaches could be used. And when my cosmetology colleagues speak about hyaluronic acid injections, that is a very comprehensive approach, and the recommendations are good, and they're quite operational. And after many years, when you come to see these children again, they become your good friends, and you are happy because you do it right. We have quite a number of patients like that that have facial burns, and here we can see a patient after the surgical intervention. That was a hot oil byproduct burn. It's like bitumen or like the hot asphalt, something like that. a lot of interventions have already been made. They actually conducted some skin grafting, and he didn't have a projection under his chin, basically. This is how it looked like to the left. And basically his scars were all around his face. Lipofilling was the choice made. We also wanted to perform some kind of a plastic surgery to make sure that the skin projection and the chin to neck angle is restored. We decided to use the MEPOR polyethylene, rather rigid, well-fixed implant, and then we got down to plastic surgery in the neck, incising platysma and musculus digastricus. This is how it looked like during the surgical intervention. This is the implant. Let's try if we can see if we can watch the video, if it works. Somebody says no, it won't. Okay, sorry, it will not. Sorry. So basically, we took out everything from under the skin here, and we installed an implant there. So we will try the video again, and we shall see what happens. No, sorry, it doesn't work. Sorry. Well, this is how the patient looks like on the surgical site in the theater of operation. In the same time, we performed the scar repofilling in the face and also in the lower part of the lower jaw. The adipose tissue worked well, and my colleague, Mr. Karpinski, will be talking more about these approaches because we have some good cooperation with the HYALUAL clinic, and that looks pretty perspective, especially in the context of reconstructive surgery. We use lipofilling approaches almost in every case that we come across, and that looks a very reasonable approach as of today. This is how it looked like a week after, and this is how the patient looked like about 2 weeks after operation. We're quite happy. The patient is happy. The result is quite sustainable. He will have implantation and grafting of a bird. It's going to be pretty high level. And the video works, by the way. Pay attention to the left. We have quite a number of such patients at the moment. We don't want this video. Remember the patient I asked you to remember about. That's a rather interesting patient. We will be recollecting and remembering this war for a long period of time, and we will have to digest this war. And the story of this patient is rather interesting. She was pretty much mutilated, and she doesn't have her eye, and she has a gunpowder tattoo, so-called, because of a blast wave and explosion. That's the old piece of ordnance dating back to the World War I. Pay attention. Just a group of tourists went to the Carpathian Mountains. They started a bonfire, and suddenly they found that there was a shell under the tree, exactly where they started the fire. There was an explosion, people died, and she was injured. About 10 years ago, during one of the dermatology conferences, I saw something similar, maybe colleagues from Virtus, if I'm not mistaken, and he was using the radio frequency scalper to treat something similar. He would go under the derma, coagulating these asphalt tattoo. I tried to do the same. It didn't work, but I used the CO2 laser for this patient. I wanted actually to somehow manipulate with this gunpowder, and it started actually exploding under the skin. Imagine that. And I got some good result, by the way. Let's try to watch video. Maybe we can see how it happened. Using a CO2 laser, if one needs the settings, I can share it with you. So we go like one by one, and pay attention, it looks like just a firework. So when you come across just a normal common skin, it's fine. But if you come across gunpowder, it just explodes underneath the skin. If we have many patients like these, we already have developed the clinical guidelines, the clinical protocol for that. It looks to be pretty effective. We have already treated this lady. She will come for the second stage soon. And up to 50% of the total skin with such gunpowder tattoo has been treated. And I think we're gonna finish the second stage very soon. These are the consequences of the World War I, and that really is, you know, nasty. This is how the lady looked like right after the manipulation. The general anesthesia was used because it was rather painful. This is it. This is it, my colleagues, from my side. I do hope I have fit it into my time, into the agenda. Colleagues, do we have any questions? Do we have any moments for discussion? Because you have perfectly fitted into the schedule, into the agenda. Okay, thank you very much, dear colleagues. This is it from my side. We should have a very fruitful conference. Thank you very much indeed. Colleagues, the next speaker is a dermatologist, doctor, cosmetologist, multi-profile Oberige Clinic, plastic surgery and dermatocosmetology department. Yaroslav Lata is with us. Welcome. Dear colleagues, good day. Hello, can you hear me well? We seem to hear you well. We can see you well, and you look great. We are happy to hear you. Thank you very much, dear colleagues. It's my pleasure to hear you and see you as a moderator of today's conference because of your very high level of professionalism. I'm grateful that we have colleagues staying in Uzhhorod, and I'm great to see Inga Voloshina coming after me. She will be the next presenter, and I'm happy to hear the previous presenters. We have to do our job despite all the warfare going on, and in the next 15 minutes I will try to be most useful and will provide most useful information for you as much as I can. In our field of activity, we do realize there are some chronic diagnoses that this way or another depend very much on the level of stress that one observes in your patients. We do know that the chronic dermatosis might be exacerbated, quite often the case, if there is undergoing underlying stress. And quite often the case that requires very active communication with your patient. The acne similar dermatosis is the topic of my presentation. Unfortunately, we'll cover only some of them. We will speak about online consultations that we have conducted in the previous 3 months, and I will focus on those cases. So today we'll speak about some interesting cases of acne similar dermatosis. There are 4 statistically important ones. Hello, dear colleagues, I can see you on the chart. If you can see me and hear me well, please put a plus for me on the chat box. So we will speak about acne, perioral dermatitis, rosacea, and seborrhea dermatitis. What is interesting here is that quite often the case, as of today, people do not use the evidence-based approaches, and sometimes they use absolutely non-evidence-based approaches. And as a result of that, the condition might exacerbate in your patient. And definitely, if this is a patient staying in the bomb shelter for a while or staying outside for a long period of time, the patient cannot simply stand it because it itches, it feels itchy, it is very irritative, and that leads to high level of neuroticism. And we know that the CNS irritation is pretty high in those conditions. This is a rather complicated case of acne. That's a moderate level of severity. And the same situation you can see on the shoulders and on the skin of the back. That is a rather complicated case because the patient was breaking, was scratching these pustulas, and we see secondary infection. After we decided to make a bacterial isolation, what we detected, we found the hemolytic quality intestinal infection. It was rather resistant to a majority of antibiotics. Therefore, we had to combine them in a very systemic way. It was all made in the online mode, and we had to make sure that he kept and he observed all the recommendations. We got a rather good result, I would say. That looks like a post-acne picture, and we see that the process is not active anymore. I would like to focus attention of my colleagues working in the field of cosmetic dermatology. You should realize not a single injection can treat the active acne. So basically, you should not suggest peelings to the patients because they do not help. They can dry it just a bit, they can improve the situation just a bit, but that gives you a kind of a false hope. And one may think like, well, I take the course of peelings and get some good results. No, acne is a chronic condition. And there is a whole complex of that. And speaking about men, we're quite limited. We cannot use some blockers, testosterone blockers. You can use a screenshot of these recommendations. This is a recommendation from the European Dermatovenerology Academy. In this case, we had to use a combination of systemic antibiotics. In this case, it was doxycycline and a course of ocloxacin, and only by doing that, we managed to remove the inflammation and remove the infection that joined this process.
And this E. coli is actually the witness of very fresh fecal infection. So you have to understand that if it's a bomb shelter, lack of hygiene, unfortunately, that might be possible. Later on, the patient started to receive systemic isotretinoin, and now we've switched over to clindamycin and adapalene combination. But in order to prevent the color skin index, azalein acid was prescribed as well. So we've had to go such a long way, such a long path. I'm sorry. So is everything okay? Can you hear? Hopefully. What is not recommended? Yeah, everything's fine. Thank you. So combined or monotherapy, local monotherapy in such moderate severity cases, because it could be mild and might be complicated, but with complicated cases, monotherapy is not going to work. Systemic antibiotics in monotherapy should not be prescribed. So it's topical plus systemic therapy. Then systemic antiandrogens as monotherapy, if we talk about women, is no good. And also another myth that still lots of our doctors like, and I face that quite a lot, like we tell people to get suntanned a lot. That's not treatment. And the next diagnosis to discuss, and probably those who are in my Telegram channel, you probably know that I discuss such cases quite often. So here, unfortunately, you can see a patient where the inflammation has started only in the alar area. So first the diagnosis was a seborrheic dermatitis, and the treatment was prescribed but with no result. Later on, the same doctor prescribed methylene blue, Yaroslava, if you can hear us, hopefully you can hear us. We have some connection problems. Hopefully you will be able to do something about it. Maybe our technical personnel will also help us. While I'll have just a minute of time, I will just remind our viewers, ask your questions, please. You can ask any of our speakers, you can ask anything. So right there in translation, in the broadcasting chat, please. And now we will continue to hear Yaroslav. Thank you, Volodymyr. Thank you. So, okay, now we can see that this humidification exacerbates this condition. So in perioral dermatitis, we don't do any procedures like that. So please pay attention. If a patient has such a condition, even anesthesia cream application is no good. If you use some topical products, you will get exacerbation and in periorbital area as well. So you can see how it gets reduced, some remnants on these pictures, and there are some happy pictures, even with some makeup that the patient has sent to us. And well, we are happy, dear colleagues. Well, you can scan this QR code, dear colleagues. Please have a look at the guidelines suggested by the Institute brand and also make a screenshot because you can see some recommendations, DAGV to treat perioral dermatitis. And please pay attention, a very simple combination, metronidazole, which is Rosamet, 1%, concentration. If you cannot use that or you cannot find that Metrogil, so 0.75%, but it's still efficient. Sulfur 5%, clindamycin or erythromycin, it's topical therapy, and microlimus, tacrolimus, and 4 to 6 week course of treatment. You change the therapy only if you don't see the result. So topical steroids are prohibited in this case. Otherwise, you will get a very fulminant exacerbation after you stop the topical steroids. Systemic therapy, if required, it's tetracycline, erythromycin, doxycycline, or minocycline, prescribed, indicated in respective doses for 2 to 4 weeks time. Please pay attention. It's quite a long time. And the condition in many patients gets improved even in smaller doses. For example, doxycycline 50 or 100 milligrams once daily. And so you can decrease this dose. Rosacea, very often and very frequently I talk about this kind of condition. So this is the patient who came to me, who got exacerbated in the papillopustulous form, as you can see, and we saw edematous face in general. And the skin was painful. That's how she described that. I didn't decide to show the video because 15 minutes is not a long time. So without video, we understand that she's going to be sensitive to anything, to temperature changes, to sunlight, to any food that she eats. And unfortunately, in conditions of war like today, so to provide adequate humidification and wet cleaning sometimes is not possible and get sun protected. They suffer, they cannot sleep. Patients like that cannot have a quality life. And right here, as you can see the results, the outcomes, we can see the reduction of this rash. In my Telegram channel, you can see more cases, so please join in. So here you can see it's reduced and subjectively nothing, no itching, no burning, and the rash itself subsides. And I will show you later on the final result. And at that time, we might start talking about supporting the skin microbiota. And in this case, so there is Institutum brand Superbiotic that is really helpful. And if we need some gentle anti-age therapy, this is the serum with vitamin C, GT technology, vitamin E, and 5% niacin amide. It's anti-inflammatory antibacterial product that we can use. And the Institutum has such a product that we can prescribe to patients like that. However, please have a look what we get recommended by European Association of Dermatovenerology, and what this patient had is shown in red. Prolonged use of metronidazole as gel or cream. It's in the morning and day, and azelenic acid 15%. Systemic use of doxycycline. So she had that course of treatment, 100 milligrams daily, and then systemic isotretinoin. And please pay attention that the systemic isotretinoin products is difficult to get in the territory of Ukraine for 3 to 6 months. Later on, ivermectin is recommended in papillopustulous type of rosacea. So if you cannot find isotretinoin, so ivermectin is more accessible if it's fulminant rosacea. In this case, we, together with glucocorticoids, we can prescribe even systemic retinoids. Please pay attention that in rosacea, using topical steroids is prohibited. And if you read the label, the calcineurin receptor blockers in rosacea, they are prohibited. And there is some experimental regimen for 3 to 5 days. We might still prescribe them such drugs in order to act on a exacerbation. But please pay attention and take a good history and make the correct diagnosis. And our main task is to teach our patient to live with that condition. And please focus to that in such conditions, patients cannot get suntan, and also they have to control the IV irradiation index. If it's perioral dermatitis, sunscreens can trigger exacerbation again. And usually it's not recommended to our patients sunscreen. I just ask my patients not to be in the direct sunlight. If it's not possible, then they have to use the sunscreen because it's an additional factor for exacerbation of dermatosis. This is seborrheic dermatitis. I don't know how about yourself, but it's my diagnosis for my life. So with the first stress on the 24th, I really felt this itching. You cannot go anywhere, you cannot get anywhere, you're just scratching yourself and you cannot think of anything else. Very nice case, all the central area, facial area, and the hair, and also the ears, the chest, everything was itching and everything was red, very high discomfort. We were able to get to treat that, but again, topical steroids should not be used. In this case, please, superbiotic of Institutum, please pay attention to that. And this brand has very good acidic products because they decrease skin sensitivity, as we can see. Dermaflorella prevents even age-related changes, and also the prebiotic complex restores skin microbiota, which is really important because that is one of the main products and means to prevent chronic dermatosis as of today. Again, what the European Academy of Dermatovenerology tells us, in this patient, we used metronidazole gel 1% and azelaic acid, as you can see. And there is, well, the many conditions might be treated with the same combination if we're not talking about too severe cases. Systemic low-dose isotretinoin for 3 months. Shampoos, special shampoos can be used, and please pay attention, low activity local corticosteroids, hydrocortisone, mometazone. That is something that allow us to act on exacerbation. So calcineurin inhibitors, pimecrolimus, tacrolimus are available, combinations of sulfur and sulfonylamides, and also the tea tree oils, ketoconazole, cyclopirox. That is something that is affordable, available. If it's a severe case, we can add the systemic fluconazole treatment on top of that. So please pay attention to that and just respond on a timely basis. If we talk about consequences of acne-like dermatosis, first of all, it's post-inflammatory events, which is scarring, skin scarring. And in this case, we can use, and it's no secret for you, dermal subcision can be done, which is nano-healing, perfect skin complex. We can use redermalization in order to improve the condition, and I will demonstrate such a procedure a little later, so please follow the social media. Whoever, dear friends, has questions, please ask me. Well, and I'm within the time that I was given, and I also have almost 4 minutes to answer any of your questions. Dear Yaroslav, in fact, I don't know about the audience. Well, do you have questions in the audience, or do you understand everything? It's either you understood everything or nothing. Well, in my chat, I can see a question, systemic use of metronidazole, what do you think of that? Okay, so please answer. Well, that's okay. You will still have your time to ask your questions. Yeah, okay, so viewers are waiting for your answer. Okay, systemic metronidazole, that's true, can be used if clinically you suspect the Demodex tick bite, and many people think it's saprophytic flora and should not be treated. But if you take a scraping and you can see 30 or more, then you should treat. Then systemic metronidazole should be prescribed, because otherwise it would be difficult to eliminate that tick. Dear Yaroslav, thank you for this answer. In fact, you didn't read everything from Alexandra Gus. There was not only a question, but she wrote, it's a wonderful regimen of treatment. Thank you. So that's a compliment to you. Dear Yaroslav, thank you so much for being with us today, that you found time to communicate with us. We value that. Hopefully we will see each other soon. Right. Yes, I love everyone. That's my sign to all of you. Take care and please be safe. Thank you. Thank you. A round of applause to you. I'm sure that you can hear the round of applause. Just to remind our viewers, please, you can ask your questions and there'll be time for 2 or 3 answers right during the conference to answer them. But if not, then after the conference, they will find more time to answer all of your questions offline. And our next speaker is a dermatologist, specialist of injecting cosmetology, Oksana Pashkovska, international HYALUAL trainer. Hello. Well, I will just adapt to the place where I am. In fact, dear friends, I'm so happy to be here with you live in this auditorium at this event. It's a great value for all of us. It's a freedom to go where you want to go, a freedom to see people that you like and love. So we will just enjoy this communication and we will spend this time with pleasure and take everything useful that we can. So since the war has started, I believe a lot of doctors have asked themselves whether we are doing the right thing. Like I started to think about that. Well, I'm enlarging lips. Okay, so now the war, what am I doing? Maybe it's not, well, not quite a serious thing that I'm doing in these conditions. And when I saw the result of my procedures, how my patients respond to my procedures, I got the answer to my question. So I would like to show you a video and maybe I will motivate some other people. Maybe some people will get the answers to their questions. Now we need some sound. Unfortunately, the translators are not getting the sound. Translation not possible. Technically, translation is not possible.
Я не могла сама справлятися на фоні от такого стресу.
Okay, so that was a lot of stress, and I didn't pay attention to my appearance, and I was looking in the mirror and I didn't like myself. I didn't like what I saw, and my husband told me no emotions, and he says, I forgot your sparkle in your eyes. I don't see your smiles, but the God turns all evil into good anyway. And we've met Oksana in the Western Ukraine because the war has made her flee from Kiev to here. And then Oksana has suggested to improve my beauty. And before the procedure, I was afraid of pain. I was afraid that about the symmetry, and I was afraid not to look like an artificial doll.
I didn't want to look artificial. I really wanted my husband to like me. I didn't want to see any drawbacks of these interventions. But then Oksana demonstrated some of her previous achievements and cases. I trusted her. I believed her. I knew she was the professional. Right after the procedure, I took a look into the mirror and I was quite happy. I liked everything. I liked the cheeks, I liked the chin, I liked the eyes, and that was the immediate perception, and I was quite happy about that. And then every next morning when I woke up, I felt like I had to rush immediately to see myself in the mirror, to have a makeup, and it really actually restored my willing for life. I keep listening. I keep hearing lots of compliments from other people. People say, you got fresher, you got younger. And this is how I feel myself. I feel myself better outside and inside. After the procedure, I felt more creative. I felt like living and like seeing the next day, the day of tomorrow. So I'm grateful to Oksana Pashkovska for her efforts and for her work. I do believe the war is going to be over, and I do believe Ukraine is going to be victorious, and it's all going to be Ukraine. It's all going to be Ukrainian way. This is not yet over, Oksana says. This is something that is extremely motivating to us. The fact that you bring good to people, you make people happier. This is something that changes the situation for the better. And now, for the doctors and for the participants, let's analyze and review what has been done. Now, if we look closer, we see some involutionary destructive changes in the skin of skin. We see some ptosis features. We see that the oval of the face has been changed. We also see some pigmentation available. And that was included into the preliminary diagnosis. That was the involutionary destructive changes, ptosis of soft tissue, level 1, microgenia, and melasma. Our task was actually to remove these features as much as we could with the use of a filler. We wanted to remove as much as we could these marionette lines, fix the tone of the skin, and therefore I used the Alexa filler for my decisions. When the patient tells me he or she would like a delicate decision so that the person could retain its personality after the correction and does not want to have like discriminate or distinguishable changes and still to get some rejuvenation, I keep saying that is one of the best fillers, which does not provide you with any negative results, but only provides you with a very harmonic, natural result. This is why we use the Alexa filler. The benefit of it is the edema factor is 1:1 only. The filling factor is 1:1. So if I go for 1, I get 1 milliliter result. It does not depend on the menstrual cycle, on the other conditions, and you do not see any edemas, you do not see any swelling. And there was an analysis conducted comparing different fillers available on the market here. Let me get back. One more benefit is that it has a lower rate of cross relations based on the BDDE. There is a comparison with other fillers that makes it more plastic, that makes it easy modeling. It does not have pro-inflammatory influence on the surrounding tissue. It can be easily removed, easily eliminated if you wish like doing that. You can do that very easily. I keep teaching doctors and newbies in this field, and I keep telling them, you better select the product which you know how to manage, which you know how to deal with. And this is true about Alexa. So what has been done to this lady, Ivanka? This is the technique that was used for lip segmentation. This is the way it looks like. We actually wanted to make it just a bit bigger. We used 1 milliliter of Alexa volume filler. Pay attention to the zygomatic line. We decided to make it look more distinguishable. 1 milliliter of filler to each of the sides. I like when the line goes in parallel to the lower jawline. Looking into the chin and taking into account the foramen mentale and the blood circulation in this region, I decided to use the cannula for the injection. You see, that's the point of injection, 1 milliliter of Alexa volume. It allowed it to go under the muscle and come up with 2 projections at the same time. We do know that the approach should be rather comprehensive. A gynecologist and some additional specialties need to be consulted in this case. And what I started with, I actually started using the HYALUAL intradermally and the brightening peel in one procedure. This is the protocol, how it looked like. Additionally, we prescribed the anti-wrinkle brightening serum for the sake of antioxidating protection and also for the sake of light brightening of skin. We know that the situation requires a very careful, cautionary approach, and we should not be aggressive. You can look into the protocol from the Institute for Hyperpigmentation, and you can use it for your patients as well. Pay attention to the patient. Pay attention to these 2 photos. You already watched the video, but the outcome was pretty harmonized. The face looks pretty fresh, does not look fatigued, and the lady likes the way she looks in the mirror. This is what actually helps a patient a lot. Even from a psychological point of view, that is a very good support. And I would also like to demonstrate one more case to you. When you make one lady happy, definitely she tells about that happiness to her friends. And I was happy to have a chance to provide this happiness to another lady. Oh my gosh, it is so nice. And she told me, yes, I came across a very experienced lady. She's a doctor. And if you want, I can actually invite you for a meeting with her, and she can do the same to you. I said, like, no, I'm pretty much, frightened of that. And I have a very, I'm very much afraid of pain, and I suffer from pain a lot, and that was one of the factors that prevented me from doing that before.
Доброго дня. Мене звати Марія.
Hello, my name is Maria. I am 31. On February 24, when the war started in Ukraine, the first you felt was panic, fear. You start packing your bags. Everybody talks about everything, and you feel like you need to run away, you need to flee. You are nervous about your friends, about your family members, about your children. All this stress, all this panic, definitely, it could be seen, it could be observed on your face. And when you open your eyes just a bit and you look into the mirror, you feel like, oh my God, something is happening to me. It is happening to me. And I always loved such a procedure as a lips correction, as I call it. I wanted to correct it to make it just a bit bigger. But my fear was was as follows. The procedure is quite popular, but it is not very effective. It is not. It doesn't give you a good result in all patients. So let's analyze the face of Maria. So the face looks quite rectangular. It looks like a quadrangular, basically. So we can go with a filler to the temple area to create some lifting effect in the mid-level here. We can also delicately work with the zygomatic bone to make some additional lifting effect. The piriform foramen here could be another target. We can reduce the way the nasolabial fold looks like. I would also like to raise this zone just a bit up so that we could camouflage the ptosis. If we look into the chin, we can use some filler as well. If we look from this side, the Ricky line basically allows us to do that, and we can harmonize the profile of the face. We will refresh the lips just a bit, pay attention to the angles of the lower jaw. We could make them look more distinguished because they're quite wide at the moment, but the face is pretty quadrangle format, so to say, and it could become even more excessively quadrangle. So we decided not to do that. So we will go in the upper part of the face, and then we will also focus on the chin. So let's look into the temple now. Okay, we need to find these bone arc here. This is the access point we can use for injection. We can also reach the mid-third of the face from here, or we can go just along this vector using the bolus technique. We also would like to get to this depreciated angle of the mouth, chin here, and lips. Alexa volume was used for lips augmentation. Well, the technique is the same, just in the previous case. It's a 30G needle. It's a bit inclined. The filler, Alexa volume, can be squeezed through the needle very well. It goes very well. I like using a needle like that. But if you are the beginner, it is suggested to use the needle which is included into the set. You see, we go under the muscle here in the angles, depreciated angles of the marionette lines. We use bolus technique for the chin. This is Alexa volume. Alexa volume has been used so far in all of the sites. Zygomatic bone, 0.5 from both sides. The face is pretty wide in the mid-level, so we would like to make a kind of a vector of the line, so to say. We don't want to have the zygomatic bone too big. Speaking of temple, I'm going to use a cannula, intrafascia, pretty deep. I go in and I inject Alexa volume. It's intrafascially. I expected to be there, but then I felt it. My name is Maria. I'm 31, and we can compare it now. Oh, she says. Wow, that's cool, she says. Pay attention to the cheeks, to the chin, to the nasolabial fold. I like it very much, she says. And we definitely tell the lady that the swelling is will fade away, and it will be even better. So this is why I like my job. With only one procedure, you can make a very good mood to the person. You can make the person happier, and you can give a good belief in the future that everything is going to be fine. It is either very clear or everybody knows what to do. Well, actually, on the chart, I can see that everyone is absolutely happy and everyone is absolutely grateful for that. And I can see myself that the difference is like very evident. There was a QR code on my presentation. Can we please go back to my presentation? Here, with the use of this QR code, you can find my additional contact details. Should you have any questions, you can ask them with the use of some social networks, Viber, Messenger, or whatever. These are the really harsh times that we're going through, but the Bible says the one who hopes for God will not be embarrassed. So let me tell and reassure everyone staying in Ukraine, victory will come, and it will come soon. So I wish you to have a very good day today and brace ourselves, dear colleagues. Well, thank you very much, dear friends. Thank you very much for being with us. It was our pleasure to listen to you, to listen to your presentation and see the result. I actually was watching that. Not all the men like the needles, you know it, but the result, the outcome is just perfect. It is extremely interesting to hear when the ladies say like, wow, is that me? So, colleagues, let me remind you now that we're going to have a lot more clinical cases for discussion. So from your part, we expect to have questions and comments following the cases from our colleagues. Now we have a dermatologist, associate professor, trichologist, the international trainer of HYALUAL, Yulia Kachuk. Yulia, welcome. Hello, dear colleagues. This is my true pleasure to welcome every one of you present here in the hall, and definitely all of you, dear participants online, from all over the globe. From all over the globe, our Ukrainian physicians, our Ukrainian doctors have been involved into this marathon, and welcome dear colleagues from other countries as well. Today we will speak about some dermatology complications, chronic dermatosis, and we will speak about both trichology and dermatology cases. And as of now, we can see that these are not only burns, these are not only injuries and scars that the patients suffer from. Quite often the case they are stressed by pain and the situation that we observe in Ukraine.
So it's really important to make them happy aesthetically as well. It's so much important to treat them and get them back to normal social life. So today we are going to talk first of all about chronic dermatosis, and today Yaroslav Lata has talked about that, and thank you, Yaroslav, for this information that you have presented. Here you can see the patient, Valentina. She's only 34, but for more than 5 years, she's been having this chronic dermatosis rosacea, a very morbid, very difficult papulopustulous form of rosacea, and our work was quite complicated. We used systemic products, topical therapy, injections, IPL therapy, and we already had quite a good clinical result. For more than 1 year, she was in remission, but with the beginning of war, this patient calls me and tells me that again, she starts to have the exacerbation. And to me, it was a big psycho-emotional trauma. So what was the problem? That this patient, even in peaceful time, she actually required psychological treatment because she had some difficulties with social life with such a phase. Okay, so she needed that psychological correction. And here you can see that exacerbation in more in perioral area, but we can see also the microcirculation disorders and very marked erythema, erythematous character, cuperosis in the cheeks and nose area as well. So knowing her difficult situation, we start treatment. How I selected treatment and what I was guided with. First of all, we need to base ourselves on knowing what kind of dermatosis. Rosacea is chronic inflammatory dermatosis. It has stages, it has multiple causes, and the basis for that dermatosis is angioneurosis that is localized basically in the trigeminal nerve innervation area caused by different causes, insolation, some climate changes, climatic conditions changes, the wrong dermatocosmeceutic products, and some medications might trigger that. And if you pay attention to that slide, there is quite a big percentage of stress being a trigger to develop or to exacerbate rosacea. So knowing that, understanding the pathogenesis of this type of dermatosis, we understand that rosacea pathogenesis is based on vessel dilatation, parasympathetic nervous system tone is increased, arterioles get spasmed, degranulation of stems of the mast cells is taking place, and also vasodilatation happens, and also the increased permeability is seen. Also, there is hyperactive immunity system. It's inherited, it's kind of inborn. So the number of epitheliocytes and mast cells is increasing, and all that leads to vessel dilatation. So our treatment should be targeted on etiological pathophysiological causes. And at this point of time, I use the following protocol of treatment. First of all, antibacterial treatment was used. If you pay attention, it was a prolonged therapy, a long-term treatment. She is from the city of Kharkiv, and she still stays and lives there. Her life, as we have already seen in previous video, as we've seen in other patients, her life actually is from one alarm to a different air raid alarm, and no possibility to take care of herself on a daily basis. It's bomb shelters, stressful factors in her life. So without antibacterial therapy, it's not possible to do treatment, and papillopustulous elements are there. So doxycycline was prescribed 100 milligrams, and then we've even switched to 200 milligrams daily for 3 weeks, and then we've switched to the maintenance dose back to 100 milligrams daily for 12 weeks. Yes, long term, because the history of that patient had papillopustulous elements before, and also their manifestations and signs on lab tests. We isolated the MODEX, folliculorum tick, and considering the pathogenetic basis, microcirculation was disturbed, so diasmin was used 600 milligrams once daily for 3 months. It's capillary or angioprotecting drug. Topical therapy was prescribed as well. That is part of European guidelines to treat this type of dermatosis. This is calcineurin inhibitors. Tacrolimus cream was used 0.1% twice daily. Also, I pay your attention, it was long-term, 8 weeks. So it's a long-term treatment. And starting from week 3 of treatment, and I would like to focus on that, when we switched to, let's put it this way, to subacute phase of this dermatosis. So the acute exacerbation phase was over. We decided to do the redermalization method, 3 procedures with HYALUAL light, concentration 1.1%, with the interval of 2 weeks. So why injections that we used for redermalization? First of all, this is the unique methodology that helps us to influence the pathogenetic aspects of this dermatosis, because when we treat such patients and when we do rehabilitation of such patients with redermalization, we normalize the microcirculation and we stimulate synthesis of structural proteins. We block the processes of chronic inflammation in dermis, and this is due to high molecular weight hyaluronic acid and succinic acid, which is the sodium succinate. And also, I would like to point your attention to the fact that it is the succinic acid, which is sodium succinate, impacts really well, influences really well, influences the positive effects in vessels. First of all, we can see activation of reparation of vessel wall, and normal tone of vessel tone is reached. Also, there are GPR91 receptors help us to stimulate the lymphatic drainage. And also we use the following regimen for rosacea treatment to use the lymphatic drainage technique that was used. Also, you can do some screenshots or just take pictures of that slide that allows us to activate microcirculation and stimulate the lymphatic drainage. And the scheme itself is based on anatomy of our lymphatic system. Micropapules, 2 ml, lymph drainage scheme was used, HYALUAL light was used, and all these 3 procedures were done following this delicate scheme. And you can see the results before and after. This is after 3 redermalization procedures. This patient continues both systemic and topical therapy now as well. We also plan to do the maintenance redermalization course of treatment. We maybe not use it, not as often, not every 2 weeks, but maybe once every 4 to 6 weeks. And you can see the that inflammatory event subsided. And also practically 100 improvement of microcirculation in the area of nose and cheeks. So considering that, we include this treatment, such procedures into treatment, both in peaceful and wartime. We can recommend such protocols. Another patient, this is Ina, she is 27. She came with complaints, hair loss, very active hair loss, up to 200 hairs per day. And we know that the normal range is up to 70, maximum 100 in the telogen phase, hair loss. And also This patient noted that during combing and washing her hair, there was a lot of hair loss, and the volume has decreased, and also there was greasiness, increased greasiness, areas of inflammation and scaling. History. This patient has symptoms of hair loss, started to see that since January 2022, but after the stress that she connects, of course, with the war, because she starts to see exacerbation in March this year, and inflammations with yellowish scaling. She started to see that, itching, hair greasiness, and also we asked her, why do you think that happened, whether you had it before or not? The patient says that maybe it was connected to hygiene problems. For some time, I didn't have the opportunity to wash my hair because of being in the bomb shelter, no water, things like that. She's also from the city of Kharkov. At the end of March, beginning of April, we can see a very marked hair loss. And if you pay attention, in January, it started in January, but since the end of March, beginning April, it's more manifested, can be related to stress as well. And this is actually the clinical picture, characteristic of telegenic alopecia, when we usually relate it to stress factors in the first place. As well, there are some seborrhea manifestations. So our treatment is going to be concentrated on treating two pathological conditions. First of all, if we talk about telogen effluvium, it's a very frequent problems in that patients come with to trichology doctors. We started to face it more in post-COVID time, but also as of today, more than 100 days after the start of war, we also get patients who come complaining of very active hair loss. And the sign of telogen effluvium is lots of hair loss and hair follicles. If you look at them trichoscopically, we look at them and we see that they come to the growth phase, to the loss phase, and also acute telegenic alopecia less than 6 months and can spontaneously subside on therapy, or spontaneously subside or on therapy, or chronic telegenic alopecia might happen, which is more than 6 months, 6 months and more, sometimes even a couple of years, and it's kind of like wave-like course. Patients talk about this course of disease. So trichoscopic signs of telogen alopecia are the empty hair follicles, solitary units, perifollicular spots, increased hair intelligence, and growing hair. And if you pay attention at the etiology signs of telogen alopecia, number one is chronic diseases and stress. And of course, with stress, our patients very often get the endocrine diseases and endocrine problems. So if they come with hair loss to us, they need to be thoroughly examined by other specialists as well, by endocrinologists. So you should recommend and refer them to the endocrinologist, look at the like adrenal glands, sex organs, and just to find the causes, the primary causes, and stress, the stress that we've been discussing for a long time, both acute and chronic stress. If it's an acute stress, that was felt by our patients from the very beginning of war, and now all our patients are in chronic stress. And it is the chronic stress that leads both to chronic diseases and chronic course of some dermatosis. Also, it leads to earlier aging in our patients. And we note that, we see that. At this point of time, we tell how important to support every patient, how to make them understand the desire to live and for them to see the value of life. That's important. So I would like to thank all our specialists. We've seen the previous case shown by Oksana. It's a wonderful example in aesthetic medicine. If we talk about trichology patients, for some of them, it's a huge psychological problem that requires timely treatment. First of all, we've used systemic therapy, topical therapy, and the injection therapy. Speaking about the systemic therapy, we talk about acute course of telogen effluvium. So first of all, we prescribe L-cysteine treatment yeast and SIP complex in combination. Pantagar, Pantavigar drugs or products should be prescribed. Also, we should recommend them not less than for 4 months. It's a long-term treatment. Considering stress factor and considering seborrheic function disorders, we recommended this patient Magnate B6 anti-stress 2 capsule twice daily for 1.5 months and zinc in Zintegral product 1 tablet for 1 month, because this magnesia zinc regulates skin function and hair function as well. Speaking of topical therapy, we've used combined topical glucocorticosteroids as lotions. They have the keratolytic function. You remember about seborrhea in our patients for 14 days, once at night. And also, we use the antimycotic shampoo with ketoconazole, 2% Nizoral 3 times per week, also for a long time, 6 weeks. And after that, after we have treated the seborrhea signs, we've switched over to injection therapy, and we've recommended her to use Electri product course of treatment and Perfoskin as nano-healing procedure. I would like to say right away that this is a usual standard peaceful life protocol using such injecting procedures. At this point of time, well, probably we can combine both. So we cannot always combine, so we have to choose what is better. In our patient, first of all, we did the nano-healing procedure, considering that this is more intensive treatment care. It's like microneedling, needle use. It's activity that acts on epidermis and papillary dermis because it's targeted delivery to the vital components of the product to the targeted area. Of course, it's hyaluronate, it's sodium succinate, and also the growth factors, the whole pool of growth factors that we need to deliver there when we roll this device on top of skin. So we use it in our therapy. And in Electra, we also use a different method, a different methodology, because we impact the reticular dermis, because that's where the hair follicle is located. And we have the data that there are succinate-dependent receptors on the hair follicle also. So that is why our product is going to be very targeted, very direct in our patients. If we look at this slide and we pay attention to that,
what synergy of vital components impact the course of the hair's diseases, and the factor of growth as a trigger factor can help, can improve the engrafting of grafts. That means we can use the nano-healing techniques for preparation of patients for hairs grafting as well as for reconstructive surgeries. We can also improve the regenerative functions. The antifibrotic effects from HYALUAL, Electri, and Perfoskin containing complexes could be used, and they're quite effective. So we can see how efficient it is to use these techniques and these approaches. You can screen it for you. This is a classical approach of these techniques. Number one to the left, this is Electri. It's under 1.5 milliliters, usually micropapillary technique, 1 centimeters distance between the injections. And speaking of Perfoskin complex, usually the volume is 5 milliliters. We go by hair rows like these, and we go to the left and to the right of these hair rows. Then, after just 4 procedures of Perfoskin application, and with the use of general treatment approach, we can see the reduction in manifestations of seborrhea. We see that the hair grows, improves, and trichoscopically, we could see the increase in the number of new hairs. So basically, that's about growing new hair. That was economically weighted decision by the patient. And during the next stages, I guess we will add the Electri to the treatment regimen. Thank you very much, dear colleagues, for your attention. And I recommend you to use the well-established, the well-double-checked protocols of treatment, not only the ones that I voiced out to you, but also the ones that will be shared with you by other Ukrainian colleagues. This is the time when we achieve invaluable, absolutely outstanding skills and knowledge, and we can share it with you from all over the globe. Julia, thank you very much. We actually have a couple of questions. I'm trying to monitor our chart, and we have a question from a colleague of yours who was presenting about 30 minutes ago. And the question is, the perioral dermatitis treatment approach in pregnant. Could you please speak more about that? Thank you very much for this question. That is a rather important question as of today. Women get pregnant, women deliver babies during the wartime, and they must be healthy and beautiful. During the treatment of pregnant women, definitely one cannot use antibiotic treatment, retinoids, but we can use some dermatocosmetology products that could focus on pathogenetic chains of these or that conditions. Speaking of perioral dermatitis, we would like to reduce the inflammatory events. So topical zinc, topical cuprum zinc solution could be prescribed. Some other topical products like those that improve the vascular level. Speaking of local problem, and you see some acute inflammatory processes going on, which cannot be overcome by dermatocosmetic products, one can use some topical antibacterials that are allowed for pregnant women. So basically, that is about the decision of a doctor when he sees the patient, but the systemic antibacterials are not prescribed in this case. Yaroslav Lata is asking, Diosmin prescription was caused by what? Diosmin, Yaroslav. That is angioprotector and capillary protector of phlebidia. When we speak about rosacea, we know this is a problem with the vascular level. Therefore, Diosmin was prescribed. This is a Prebodia product that was prescribed to protect the vascular level. How do you combine Electri with Perfoskin in case of alopecia? Well, in the peacetime, we suggested to use it step by step. So the first step would be electri. The next step after 2 weeks would be Parfaskin. And we could recommend something like 3 or 4 sessions like that, according to the protocol. Looking into our case, you see the protocol has been changed just a bit, but you see how effective it turned out to be. So basically, we can use it one by one with a 1-2 weeks difference. Can other techniques of HYALUAL injection could be used during rosacea? As you could see, during rosacea, I recommended to use, how they call it in Russian, very cautionary technique. We know there is a myth circulating that the skin with rosacea should not be touched upon, but being professionals in this field, we know how to use the injection techniques, but these are very sensitive, very cautionary techniques like lymph drainage techniques, and also the one used for the trigeminal nerve projection. The other techniques are quite more aggressive, and only those patterns could be used that do not cover the whole projection of skin. So you can use our recommended techniques so that you could get some good therapeutic results. Thank you very much, Yulia. Thank you very much for counseling us. Thank you very much for being with us. Please join the audience, join the hall. Colleagues, thank you very much for being with us. Thank you very much for asking your questions. Let me now give the floor to the next speaker, the plastic surgeon, the international trainer of HYALUAL, Alexander Karpinski. Colleagues, hello. That's my true pleasure to be able to speak in front of you. I actually recollect the February 23. I got back home from job, and I was actually finalizing my presentation. I was planning to have a HYALUAL conference on February 24. So when all that started in the morning, the idea that hit my mind was that maybe it will never happen again that we will be able to see each other either in online or offline format. Nevertheless, we are here today, and this is due to the armed forces of Ukraine that safeguard us. Please remember the war is going on, so please support the armed forces of Ukraine so that they could force the occupants off the territory of Ukraine, and we could go on with our normal peaceful life again. And we're also grateful to the HYALUAL company that gathered us here and made it possible to exchange our experiences and share our knowledge. Today I will speak about a rather topical issue, which was quite reasonable before the wartime, and it is still quite reasonable as of today. We have quite a number of patients with scar deformations, problems associated with the changes in volume. Alexa is one of my favorite fillers, and we do use fillers a lot, but being the surgeon, I would like to speak about something new, some novelties. I would like to share with you some novelties. So let's speak about a lipofilling. That is a technology that could be used as a surgical intervention as well as dermato intervention in some other countries. We have dermatosurgical specialty in Ukraine as well. So I do think that the surgeon colleagues will be able to do that soon. Lipofilling is a plastic intervention to correct the age-related changes in the face and the contours of the body. And it's about transplantation, grafting of adiposity tissue of the patient from one area to another. Indications to lipofilling. It's beautification, which was talked about more often during the peacetime, of course. This is what the fillers are used for quite often, the case. Contour plastics of the zygomatic area, lips, chin. On the other hand, the next indication is rejuvenation of face. The next would be modeling the volume of the body. Filling fillers sometimes can be very costly if you speak about large areas, but adipose tissue is quite often available. Another indication is the correction of scar-associated deformities. The technique is pretty easy. You have to collect the adipose tissue. You make a prick. You use a special cannula. You can see it on the lower part of the slide. And you basically cut this adipose tissue bits by bits, and then you collect it with the special syringe. I will show you a video. Then some sedimentation process has to take place. And then when you see the pure fat stain there, then you change it from one big syringe to a smaller one. And then with the use of appropriate needle, appropriate cannula, you can do that. The procedure looks pretty simple, but there are still some challenges that one may come across. Number one, these are problems associated with improper injection of this fat, of this adipose. Just like with fillers, you cannot go superficially above the fat packages, because in this case that can result in contouring and lumping. So we're basically talking about deeper injection, deep injection. The other problem, that's a transplant. So in other words, you tear off these adipose, this fat from the nurturing system, and you put it to another area that does not provide any nurturing to these cells. So sometimes there might be a request for hypercorrection because about 30–20% of these tissue will not operate properly there. There are some different theories supporting why is it so. Some say, well, there should not be contact with the air, so you should perform it as quick as possible. But the literature does not hold any evidence-based reasons for that at the moment. About 4 years ago, I started thinking about some theoretical ideas, how one can find these explanations in literature, because the succinate product from HYALUAL company in dermatology is a well-known one. We know about really unprecedented, and I would even say unique activity in the skin. So I decided to look into the data, if any data is available about the activity of this product in the adipose tissue. And what I found a very interesting endocrinology article that tells us that in case of hypoxia, the succinate receptor gets activated. The previous presenter, Yulia Kachuk, spoke about that before. So during hypoxia, the stimulation of a succinate receptor leads to a situation when the adipose tissue stops its atrophy. So I thought, is there any succinate receptor on the adipose tissue? We know that the succinate specific receptor, GPR91, is a biggest family of G proteins available in the majority of tissues. These are energy-dependent tissues like brain, heart, and kidneys. But speaking of adipose tissue, they never found it. So I actually thought, Could it be found? Can we somehow find it? Is it available in the adipose tissue? And the HYALUAL company decided to support me, as well as the Cryogenic Institute in Kiev city. We conducted a study that was stopped, unfortunately, by this terrible war, but we still got some intermediate results. So this is really a piece of novelty, I would say. So the purpose of the study was to find and identify the succinate receptors in the adipose tissue. Number two, we wanted to double check if the stimulation of this receptor by means of succinate containing products could improve the better engraftment, and that could improve the lipofilling procedure. So the point of this study, basically, we wanted to do that in vivo and in vitro simultaneously. I will tell you what happened in vitro. And speaking of patients, we would take one of the half of a face, would use the PRP. The other would be treated with electri and containing succinate, sodium succinate. Then photofixation would be performed, and the questionnaire form was used to ask if the patient was satisfied. So we had 10 patients with the involutionary dystrophic changes in the face. They were performed with a procedure of lipofilling. 50 millimeters of adipose tissue was collected. Half would go to in vitro, the other half would go to in vivo treatment. As I mentioned before the procedure, half of it was treated with PRP, another half was treated with electri product. So at the preclinical stage, we wanted to find the availability of receptor succinate N91 on adipocytes, and to check the proliferative activity of these adipocytes under different pre-treatment with different products. You remember that was PRP used in one of the tubes, hyaluronic acid in another tube. The third tube, succinate was used, and the electri also was used in the last tube containing both of the previous products. During the clinical stage, we wanted to assess the efficiency of this engrafting, comparing the left to the right sides of the face using the photofixation, electri, as well as ultrasound approaches. The preclinical part included the following. Before the intervention, the Institute for the representative of medicines, cryogenic medicines institute would come to us with a bag of different adipose tissues available. I would do the liposuction, and I would give her the 50 milliliters of it, and then she would take it as quickly as possible. That was possible to her site. Then I would continue simultaneously with my patient. So I would use this adipose tissue to the one side of the face with PRP. To the right side, I would use the same adipose tissue from the patient pre-treated with electri. For 10 milliliters of adipose tissue, we would use 1.5 milliliters of electri product. So basically, it was just one syringe. So now, to evaluate the receptor profile, we used the immunohistochemistry method, and that was for the first time that we detected the succinate receptor on the adipose tissue. We saw it and we took a photo of it. So now we can speak about evidence used for stimulation of this receptor when you inject it with the adipose tissue.
And the study stopped due to war, but I'm very much sure that we will continue that as soon as we get the victory. And this is the proliferation, the depocyte proliferation, 5 tubes, one with saline, the other one was PRP. Number 3, there was just hyaluronic acid. Number 4 tube, sodium succinate, and number 5 tube had the hyaluronic acid and succinate acid HYALUAL electric product was there. And so far, the outcomes and the results are blinded by the Cryomedicine Institute so far, but just looking at the graphs, we can see that it's true. And one secret that I can share, that the succinate has 5 times higher efficacy with regards to depocyte proliferation compared to PRP. So it is a kind of a victory already. So there is a big future for this study. It's really huge, especially in our conditions when lipofilling is one of the basic procedures. And Serhiy Derbak, my teacher, used to say that this is one of the major basic procedures for reconstructive surgery patients. Well, probably people doesn't know, someone doesn't know about electric, but I believe everyone knows about electric. And why we choose that? Because we wanted to choose the one with the least quantity of HA, because we are not interested in HA so much, but we are more interested in sodium succinate. So that's why we chose electric. It's 1.6% of succinic acid, which is sodium succinate, and 5.5 milligrams per milliliter of hyaluronic acid, highly stabilized. The procedure itself, can we look at the video? So there is a micro cut or pinch, like we harvest adipose tissue. It's very simple. If you try it once, then it's no difficulty to.
Жирові тканини відстоюємо, очищаємо і відкриваємо наш препарат Electri на основі гіалуронової кислоти і сукцинату натрію. І нам його акуратно подають.
Then we open the product, Electri. It is handed over to us. We use a sterile syringe. And we basically enrich our lipotransplant with the Electri product. And now, with the use of Luer lock, we just make one transition very carefully, not to break the adipocytes walls. And we want to properly mix it. And then, with the use of Luer lock, just to make it more convenient for use, we take a 1 milliliter syringe, and then with the use of cannula, we start injecting these fat enriched with the Electri product into the face of the patient to ensure proper volume. The technique is absolutely the same as the injection of fillers into the deep fat packages, adipose packages, in the sites where it is needed. This is how the procedure looks like. Now, speaking about some cases, well, there is something we can share. We have had a patient. This is a very young girl, 12 years old, and during bombardments in the Azovstal plant, she got injured. She was provided with some primary surgical care. No one was thinking about aesthetics. No one was thinking about beauty. It was only to help save life. This scar is very visible. in the face of the young lady. So in order to remove these signs of war, the parents of the patient approached me, and we have now been relocated to the Uzhhorod city, and we have the possibility to provide care, to provide support to patients like that. So I suggested a lipofilling of these scars to the lady. We see some atrophy. Pay attention, that was May, end of May, the 20th of May, something like that. So it was about 1 month ago. The scar was pretty fresh, I would say. So we decided to use the lipofilling procedure. We do know that adiposity, the fat, does not survive well in the scarred tissue. We decided to enrich it with the electric product to ensure better engraftment. And this is how the procedure looks like. I didn't manage to inject it with a cannula. I had to switch to a needle. I made some very superficial injections, as you can see. I had to perform some incisions so that I could break these scarred skin. And then, at the level of the scar, see how I injected the product. The child was under general anesthesia because that was a large stress to the child, definitely. The first picture is before the surgical intervention, then during the surgical intervention, and after. The child was in so much stress, you could hardly make a good photo of a child. So the central photo, number 2, is right after the procedure at the surgical operational theater. And number 3 is this is how the child looked like after. After 1 month, we can see that the result of this lipofilling looks pretty good. And I think the result is really good enough, and that was made due to electric product and the approach used. And this is the situation to the other side of the face. That was before, right after the surgical intervention, and the third photo about 1 month after the intervention. So what conclusions we may come up with? They are as follows. The study that we launched really has got some good, large, promising perspectives for plastic surgery, for reconstructive and cosmetology interventions. We would like to have less cases like that, of course, but we need to be frank enough and sincere enough. We will continue seeing such patients, and now, as we have such good and safe HYALUAL products that have been tested very well, they actually enable us to perform very safe and very efficient correction actions and to remove the signs and consequences of war that have been imprinted on these patients by the people who say they were coming to liberate us. So thank you very much for your attention. I think we will continue our developments in this field, and maybe during the next meetings I will be able to provide you with some more comprehensive results of our study. But so far that was a rather good intermediate success. These are my contact details. Let's become some good friends and exchange our experiences with the use of social networks and other messengers. I'm ready for your questions, if any.
Dear friends who is here in the audience, if you have questions, you might ask your questions, please. There are some questions from our chat. What other products compared, probably were compared? So PRP, hyaluronic acid, and sodium succinate as monotherapy, and HYALUAL Electra as the study drug. Okay, I'm monitoring the questions. Can you tell us, please, whether you use lipofilling in skinny, in lean women? Of course, yes. If yes, then what kind of areas do you harvest the fat tissue? Of course, we do use that, depending on the desire of the patient, depending what a patient wants. If a patient has some questions with regards to volumization, say, for example, for gluteal area, and we understand that we need about 1 liter of adipose tissue. So even if you do the liposuction of the whole body, we will not be able to harvest that big volume of tissue. But we do the assessment during the consultation. But if it's 10, 50, up to 100 milliliters, can be harvested in any even very skinny patient, not a problem. And previous question, so why did we take the PRP to compare with? Because in literature, that's the previous question, in the literature, it describes the PRP affects the quality of regeneration. So that's what I found, but the same author 3 or 5 years or 4 or 5 years later after that wrote another article that he doesn't see difference in patients with lipofilling with PRP or lipofilling without PRP. So that was one thing that we can look at, and the other thing is it was our kind of intuition, and it proved to be correct. Another question from Oksana. Thank you. Thank you. Dear Alexander, can you tell me, in that girl with a scar, was a lipofilling monotherapy? So far, monotherapy, one procedure. I think that also what played a role, it was a very young patient, a child, and regenerative potential in children is much higher, as we know, and quite a good result that we have received, of course. And also we talked to parents of the patient parents that working with a scar, it's not only one procedure or operation. We will work later on with micro landscape of skin, nano healing, HYALUAL products, other EBD devices are going to be used. So our task here was just to work on hypertrophy, atrophy in this area. Mr. Alexander, so everyone else is saying thank you very much, very informative, and lots of words like that from our viewers. So this is a round of applause to you. Yeah, and I guess this is a break. Well, I will have a little announcement what's going on later on. In a couple of minutes, dear friends, we are going to make a break for our friends who are here in the audience who would be able to refresh, take some refreshments, tea or coffee, but I will announce what we are expecting later on. Later on, we will have 5 more star speakers. We are going to talk about complex aesthetic correction of post-traumatic correction. We will talk about beauty during war. We'll be looking at clinical cases, thermal burns, second degree, and not only that, but more. So please stay with us. We'll be back at 1400s. Okay, so all the best to you and bon appetit.
Марафон переможних клінічних кейсів в рамках благодійного проекту HYALUAL. 22 червня наша зіркова команда спікерів вирушає до Ужгорода. 10 визнаних експертів перемагатимуть силою краси, знань та досвіду. 30 кейсів, 30 історій пацієнтів та клінічних детальних протоколів лікування. Ділимося тим, що має знати кожен лікар-косметолог. Вже 22 червня об 11-й. Реєструйтесь на подію прямо зараз в офлайн чи онлайн форматі. Марафон переможних клінічних кейсів в рамках благодійного проекту HYALUAL. 22 червня наша зіркова команда спікерів вирушає до Ужгорода. 10 визнаних експертів перемагатимуть силою краси, знань та досвіду. 30 кейсів, 30 історій пацієнтів та клінічних детальних протоколів лікування. Ділимося тим, що має знати кожен лікар-косметолог. Вже 22 червня об 11-й. Реєструйтесь на подію прямо зараз в офлайн чи онлайн форматі. Марафон переможних клінічних кейсів в рамках благодійного проекту HYALUAL. 22 червня наша зіркова команда спікерів вирушає до Ужгорода. 10 визнаних експертів перемагатимуть силою краси, знань та досвіду. 30 кейсів, 30 історій пацієнтів та клінічних детальних протоколів лікування. Ділимося тим, що має знати кожен лікар-косметолог. Вже 22 червня об 11-й. Реєструйтесь на подію прямо зараз в офлайн чи онлайн форматі. Марафон переможних клінічних кейсів в рамках благодійного проекту HYALUAL. 22 червня наша зіркова команда спікерів вирушає до Ужгорода. 10 визнаних експертів перемагатимуть силою краси, знань та досвіду. 30 кейсів, 30 історій пацієнтів та клінічних детальних протоколів лікування. Ділимося тим, що має знати кожен лікар-косметолог. Вже 22 червня об 11-й. Реєструйтесь на подію прямо зараз в офлайн чи онлайн форматі. Марафон переможних клінічних кейсів в рамках благодійного проекту HYALUAL. 22 червня наша зіркова команда спікерів вирушає до Ужгорода. 10 визнаних експертів перемагатимуть силою краси, знань та досвіду. 30 кейсів, 30 історій пацієнтів та клінічних детальних протоколів лікування. Ділимося тим, що має знати кожен лікар-косметолог. Вже 22 червня об 11-й. Реєструйтесь на подію прямо зараз в офлайн чи онлайн форматі. Марафон переможних клінічних кейсів в рамках благодійного проекту HYALUAL. 22 червня наша зіркова команда спікерів вирушає до Ужгорода. 10 визнаних експертів перемагатимуть силою краси, знань та досвіду. 30 кейсів, 30 історій пацієнтів та клінічних детальних протоколів лікування. Ділимося тим, що має знати кожен лікар-косметолог. Вже 22 червня об 11-й. Реєструйтесь на подію прямо зараз в офлайн чи онлайн форматі. Марафон переможних клінічних кейсів в рамках благодійного проекту HYALUAL. 22 червня наша зіркова команда спікерів вирушає до Ужгорода. 10 визнаних експертів перемагатимуть силою краси, знань та досвіду. 30 кейсів, 30 історій пацієнтів та клінічних детальних протоколів лікування. Ділимося тим, що має знати кожен лікар-косметолог. Вже 22 червня об 11-й. Реєструйтесь на подію прямо зараз в офлайн чи онлайн форматі. Марафон переможних клінічних кейсів в рамках благодійного проекту HYALUAL. 22 червня наша зіркова команда спікерів вирушає до Ужгорода. 10 визнаних експертів перемагатимуть силою краси, знань та досвіду. 30 кейсів, 30 історій пацієнтів та клінічних детальних протоколів лікування. Ділимося тим, що має знати кожен лікар-косметолог. Вже 22 червня об 11-й. Реєструйтесь на подію прямо зараз в офлайн чи онлайн форматі. Шановні друзі, знову ж таки марафон
Dear friends, welcome back to our marathon of clinical cases. After a break, we are ready again to discuss important information, to talk to our star experts. And again, I'm grateful to you that you have joined us today. And lots of guests here, lots of guests online. You can copy and the link and send to whoever you believe you want to do that. And we are located, our event is located in Uzhhorod, but practically the whole Ukraine has joined us. Besides, other countries has joined us today, and English-speaking countries as well. So, dear friends, thank you for being with us today. Don't forget to take pictures and make selfies, and you can write your feedback. It's very important to us to find out what is your feedback, what is your thoughts about our events, in order for future events to be as targeted as possible. And again, to remind you, you can ask questions to our speakers, and they will try to answer your questions on like here during this online event. If not, then you will get the answers later on. So once again, thank you for being with us, and we are ready to move on. And it's complex aesthetic correction of post-traumatic deformities topic right now. And with us here in our audience, in our auditorium, we have a dermatologist, cosmetologist, lecturer of New Generation Cosmetology School, Andrei Zimenkovsky is the national trainer of HYALUAL. Thank you. Thank you. So our lunch break is over and we need to get back to work. Thank you. I would like to thank the company for this opportunity to get online and offline. Yes, and of course, it's been a long time since we were gathering like that offline. And in these difficult times, it is really a lot that we can discuss. A lot of negative things are happening, and everything that's happening we can see in whatever complaints we have from our patients. So we have to deal with that. So I would like to show you the case of our estimate clinic, our joint case. It's a pre-war peaceful time case, but considering the polytrauma that we see in our patients today, we believe this case is going to be really relevant in these times too, because patients get traumas related to different causes during the wartime. So I will share that and start. This is Natalia. First, she came to our clinic 6 months after the car accident. Right after the car accident, of course, she had an emergency and the fusion osteosynthesis of her mandible, and there were traumas to her soft tissues and bones, and the complaints she came with to us, hypertrophic scars and multiple hypertrophic scars, and also a very severe psychosomatic status that we paid attention to, and I will show you the evidence of that later on. On this picture, you can see hypo and hypertrophic and normotrophic scars and vascular component. Also, you can see kind of bands or scar bands leading to clinically asymmetry, especially in the periorbital area. So that's what we can see laterally. And quite a big area injured. So we decided to start with enzyme therapy. So those were quite new scars, 6 months. So we decided this is going to be the most adequate treatment. In this case, collagenase and hyaluronidase were combined, and intrascar injections were performed, not only in the hyper, but in the area of hypertrophic scars, but in the area of bands and hypotrophic scars as well. So basically everywhere where we needed to do some healing. And we know that healing healing takes about at least 9 months up to 1 year. So the scar matures up to 1 year. So we decided to work there in those areas. So this is the first visit. After the first injections, we can see some slight improvement and the hypertrophy got softer. On palpation, we started to feel something that the skin shouldn't have, that not just hypertrophy, but those were kind of foreign objects, let's put it this way. And they could be palpated and they're movable. So we decided to involve our plastic surgeon, and he is with us in the audience, Volodymyr Velegheria. He did the revision of those areas of hypertrophy, and he actually got a lot of these fragments that were there. So we were surprised that they were not found at the emergency state. It was not encapsulated. Difficult to say. I don't know why they didn't happen, but the first step that should have paid attention to that first level of care, for some reason they didn't pay attention to that. So those fragments were there until we dissected them, incised them. So then we saw the improvement. Then we got back to enzyme therapy again. And once every 2 weeks, the patient comes for injections. Later on, we added fraction CO2 laser resurfacing, and that improved the results. I don't know whether you can see well, you can see some results. So first they were enzyme injections, 2 weeks CO2, and 2 weeks after that, enzyme injection. Again, quite intense regimen, but that actually yielded very good cosmetic and aesthetic result. So at each visit, we can see a significant improvement. You can compare the first visit and visit number 8. So laterally, you can see how much better it looks like. So on the other side, you can see both improvement and comparison of patient to the first visit and visit number 8. Even due to injections, we can see quite a good reduction of bands and asymmetry. Nevertheless, we decided to do the lip augmentation and laser labial folds correction as well, treatment, and we were much pleased that we received support from HYALUAL. So we asked them whether we can get fillers from them for this correction. And this company, even pre-war, they were ready to support us with that. So that's what they did. I will show you the results later, and the subsequent couple of visits, we decided to work with skin quality, and here we chose nano healing. Why? Not because it's the HYALUAL company. If it's a scar and if we want to do the combined therapy and improve the skin and scars, both this and that, we choose this option because it's a three-faceted impact, influence. Please do not take pictures. We are not closing the eyes deliberately, because here you can see what I mentioned before, psychosomatic, severe psychosomatic conditions. So the eyes, the gaze, how she looks like before and after. So what changes took place? So it's both aesthetic improvement and psychosomatic improvement. So patients come to us not only with these defects. We are trying to help them not only with physical appearance, and we cannot promise anything to patients. There are no golden standards to correct scars. So we try and do. So it's trial. So that is why the psychosomatic support is also very important. Basically, what it is, it's the most important thing. First, Ina Andrashko was her first doctor, and she is a very good doctor, and she knows how to talk to patients, especially in stressful conditions, stressful status. And we talked a lot, and we saw how this patient psychologically improves better and better with each procedure. And that was seen not only in clinical aesthetic changes, but psychologically she improved as well. Lateral projection once again. If we talk about the number of procedures, well, probably we shouldn't focus on that because I just mentioned each case is specific. There is no golden standard for everyone. And there are different opportunities and possibilities in patients. For some, enzymes will work, for some, they will not work. So we combine, we try, we think, and we just look at the intermediate results and then we make further decisions. With regards to conclusions, right now, we are living in the world of aesthetic medicine, and there is a whole armamentarium that this aesthetic medicine has today. It gives us lots of opportunities. So we have to try different things, try to combine in order to get the quality result. So it's important to not only to improve cosmetic defects, but to improve the psychosomatic condition, maybe together with psychotherapy. We should combine that. So we also have to be responsible for this psychosomatic component, try to balance correctly together with the patient. With regards to the scar correction or treatment, it's a very long-term therapy. So we need to tell the patient that it's for a long time, that they will have to actually come to us for a very long time. And second thing, of course, other specialists need to be involved for better results. In my case, I was lucky because I work with people who are experts, who have very huge experience, and they are very knowledgeable. And so Ina Andrashkov, Volodymyr, the surgeon, we work in this tandem always. So in other words, I know that there's always a person who I can rely on. But lots of us work as monospecialists. We're just on our own. But I have to tell you, don't be afraid to refer patients or to involve some other specialists. And that's perceived well by patients as well. Also, we live in times of digitalization, digital healthcare. We have the opportunity to communicate with different specialists, and we need to use this opportunity to get much better results. And also another important, interesting thing with regards to patient support. When I was getting ready for the previous presentation of scars, I think it was in England, if I'm not mistaken. So somewhere in their web space, I found that there is a special foundation to support patients with scars. So regardless of the cause, there is a patient, they can register. There is also a link to donate. Anyone can donate. That's a very good thing. And it's quite logical to use that resource. Maybe try to create something very similar here in Ukraine to unite, so to say, and get patients together who suffered due to war, and to unite doctors who are ready to provide the support and care free of charge. Maybe there should be a link there for some donations in order for us to be able to involve more funds. I think it's a good opportunity. Patients will get the opportunity to correct their defects as good as possible. And at the same time, it's one of the possible resources to communicate about the events, what is going on. So it's not going to be a picture of wars, but to show the consequences of war showing the patients. And maybe that will help us to involve more patients who are afraid to show and to talk about their problems, and they are on their own, and they are with their own physician, that's all, but we can expand. So it's a good step. We have to talk about that to help our patients. So thank you for your attention. Thank you, Andrei. Dear friends, if you have questions to Andrei, you're most welcome. Okay, while you are thinking, there is a question from our chat. So why did you start from enzyme therapy? I mentioned that during my presentation. It was logical decision because those were new scars, only 6 months scars. And hyaluronidase and collagenase are the two components for neocollagenesis, to work on neocollagenesis, and hyaluronidase was supposed to act on the defects that are already there, they are formed. And that will allow us to direct the process of healing in the right direction. And another question, for how long in general did it take to do this treatment? Hard to say, more than half a year. It's a long-term process. And we saw a case today by Mr. Deribako that it took him more than 1 year. So we have to get our patients ready for a very long time to be with us. It's a lot of work, lots of micro trauma and painful procedures, but we are going to get the good result. So thank you very much, and this applause is for you. Dear friends, I've mentioned this speaker, our next speaker, about today, so it's my great pleasure to invite dermatologist, doctor dermatologist, and the owner of Estimed Clinic, Estiderm Education Clinic Head, IMBC President, Inha Voloshina Andrashko. It's our pleasure that you were able to come here to join us, and we can talk like that live. Hello, I was not quite sure I will make it. I would make it because I had some dental work, but nevertheless. Once again, the way that we are together tells us and shows us that we are alive, we are moving on, and we would like to feel the taste of life regardless of anything. Beauty during war. Is there a place for this beauty? Of course there is. That is something I started with. I was first disappointed during the first days. What kind of disappointment? That was about my profession. My profession, my specialty. I think maybe that is something that a lot of you felt as well. People who understood that in such a difficult conditions, Botox, fillers, lips, has no sense. Nobody needs that in these difficult times. But 2 weeks has passed, and first people start to come. Patients started to call, where are you? What are you doing? 3 weeks later, they started to call every day and to say, well, please, we want you. We want you in Uzhhorod. We want to come to you. And I asked them, why? Why at such a difficult time? Why do you need that at all? And the answer was simple, because it's our hope. This is our part. This is our share of our happy future. Because when they came to us on the 24th of February to liberate us from our life. So, and you can see the poem here. So that's what happened with our conscience. Our world has broken apart. We didn't know how to act. We didn't know where to go, where to move. And you know, now it's okay. We've adjusted.
Now we have adopted ourselves, and we do realize that it goes as it is, and it goes towards our victory. I have been to Georgia recently, 2 or 3 days ago. You can't even imagine how the world supports Ukraine. I'm talking about the whole world, and I'm talking about not politicians, but the people. When people say, we stand for your victory, we are standing with you. So what happened to our patients? Right after a rather complicated situation with the COVID, people were quite, fatigued, and we have been reading all these articles like, well, post-COVID syndromes, alopecia associated with COVID, etc., etc. But imagine how it gets more complicated during the wartime. People being absolutely terrified, who fled away from their homes. And I'm not trying even to compare for whom it was worse, either for those who stayed in Ukraine or who left Ukraine. When you are beyond Ukraine and you are all alone, it might be even more complicated than staying in the same natural social society. So what do Ukrainian women think about in the first place? About children, about their children. I definitely support those women who have left the country, who have been beyond Ukraine, saving their children. But they were still standing, they were still fighting, they were still thinking about fighting back. And I remember the good friends who told me when we welcomed the Georgian women during their war with Russia, when they came to us, and they said, like, sorry, I don't have nails, I don't have good hair, but that was absolutely fine. When Ukrainian women go beyond Ukraine, even under these conditions, they want to be perfectly beautiful, and they want to be strong, and they want to have hugs. Everybody wants these huggies, these hugs. They want some good. They want to have love, just like they have had these lovely relationships with their doctors. I want to share a couple of words of gratitude of my patients. You might know that Zakarpattia region is really a place that hosted quite a number of Ukrainian IDPs, internally displaced persons, and that has become a second home. Different people are here, different people have met each other, and the only thing I'm worried about is that we, being the hosting side, the hosting party, need to be adequate enough. I want to thank all the colleagues for referring your patients to us. These were the so-called self-selected patients. They were basically transferred from hand to hand. And our point was definitely to do everything the best way possible, not to hurt, not to harm the previous treatment regimens and approaches. I'm grateful to Andriy Zimenkovsky, who mentioned that you cannot stand alone in the field, you cannot fight alone. He's quite correct, and I want to encourage the colleagues from other regions, please refer your patients to us. It is not for the sake of grasping, grabbing your patient and never letting it go back to you. And guys, we know each other well, and I know if I don't have some kind of equipment, I can always refer the patient to some other colleagues, to some other clinics for correction. HYALUAL company, I would like to thank them. And exceptionally, I would like to thank Andriy, because he's the one who really deserved to hear it for Andriy. All the products were provided in a timely manner. We have had it all available that we wanted. I am also grateful to the Allergan company that supported us with the Svetlana Larkina devoted botulotoxinum devoted webinar. We are also grateful for additional trainings devoted to multiple other conditions, devoted to focal conditions, focal trauma, etc. We don't see many patients like this, but we're ready to receive them. And I'm also grateful to the Meza Club organization that supported us and provided free of charge medicines for those patients that really had a very acute need in that. I'm also grateful to all those patients who stayed at home and for those colleagues who stayed in their sites. We have actually a very interesting case to share. This is a lady that stays with us in the among our participants. This is the lady that presented herself to us during the warfare. We actually started working with her a year ago, and I can't tell you how exactly looked like her claims looked like, but this is how my analysis looked like. The asymmetric face, the form of the lips, and the extended lower third. This is a well-known type of a face. But if you look now into the length and face and width, you see that the lower part is just a bit wider than usual. There is a certain asymmetrics in the face, in the nose, and in the lips. So we wanted to change it just a bit. Pay attention to the stages of works conducted in 2021. So first we conducted some basic correction of lips. We injected the botulotoxinum 101 into masseter muscle. Then we corrected the lips, and in the last photo to the right, you can see what has been done in the zygomatic area, and we also injected the hyaluronic acid product. I thought if we could increase the volume in the mid part, that could be more natural, but then I decided to change my mind, and I will show you how it looked like. This is a well-known procedure to everyone. That is a relatively simple procedure for botulotoxinum injection. 25 units have been injected per site. We had to perform 3 deeper injections and 3 superficial injections to prevent a so-called supercompensation of superficial masseter part, so that we do not see visualized part of underneath what is visualized underneath. This is the visual control. You see for masseter muscles, temporal muscle, for example, you need to do control after 1 month. So you see the final result as of 2021 and the final result as of 2022. So what has been changed? The masseter worked well. The face in the lower part has become thinner, so to say. We have corrected the lips just a bit additionally, because a whole year has elapsed. I do realize during your practice you come across multiple situations when a product is stored for a long period of time, and you have to do something with that, like something with hyaluronidase, for example. Therapeutic regimen looked as follows: botulinic neuroprotein, forehead 35 units, masseter 50 units, correction of the mid-third 1.5 milliliters of hyaluronic acid, correction of the chin is 0.5 milliliters of hyaluronic acid, and that was Alexa volume, and correction of form and the volume of the lips, 1 milliliter of hyaluronic acid. The botulinum toxinum was used, and Alexa volume was 2 milliliter total volume used. That is a minor correction. Please focus your attention on the results that we have, and the model, our model is here, by the way. So let's hear it. Let's hear a round of applause to her. I am very open with sharing my experiences, and just yesterday there was a joke on Facebook or Instagram, if I'm not mistaken. One of my patients say everything is natural, and I say, yeah, it is. The second clinical case is as follows. This is a joint work of me and Alexander Karpinski. We keep talking about war, that's true. And I mentioned already that unfortunately I do not have any patients to demonstrate to you with corrections after trauma or some war-associated wounds. And basically, we see majority of patients that have problems with their age-associated changes. And so the claims were as follows. The uneven color of skin of the face, some certain asymmetrics, the form of the nose, some age-related changes, and deep inside, she felt being much younger than she actually looked my side. So we have been working upon skin for a while, laser correction of vessels was used, HYALUAL 1.8% was used, and this is the result that we obtained. Definitely, we could go on with the following, and we wanted to go with a maximum correction. Definitely, extensive measures need to be used because she's much older than the previous patient. So we basically went here into the temple. We went here to the ala nasi, you can see it. The teardrow, Alexa medium was used for correction of lips correction, and also to work upon the marionette wrinkles. This is the lateral projection. Unfortunately, you can't see here the deformity in the nose that we had to correct. This is how she looked after the first and the second corrections. This is a photo before and after, and you see a huge difference. This is the same projection. You can see, and the patient is absolutely happy. This is her having makeup on, and this is how she looks like, being happy and absolutely satisfied after the completed correction. Yes, it's true, it takes time. Just like in the previous case, previous clinical case demonstrated by Andrei Zemenkovsky, it took our patient not less than 6 months, because some procedures are period dependent. You might know about this, vascular coagulation, dealing with skin issues. Sometimes it does not allow to be manipulated on during the summer period. So thank you very much for your attention. This is a photo of me with a special set of flowers on my head. It's not for the sake of boasting, but this is for the sake of demonstrating what we say to our patients. And we keep telling them, be a better version of yourself. So I'm sure if we get together, we can make a better version of Ukraine compared to what it was before. But for that purpose, we definitely have to apply efforts to that. Thank you very much. We actually have lots of compliments and words of gratitude on the chat, and they're quite happy seeing the photos. And we're grateful to the model of your patient. She's our colleague, by the way. Okay, great. She's so let's hear it to our colleague in this case. Well, as far as I see, we don't have any questions. Colleagues, do you want to say a word? Do you want to comment something? Maybe somebody from the audience, please. Being a moderator, I sometimes say, like, do you want to criticize the speaker? By the way, speaking about criticizing, in our field, it doesn't mean that you are the only person who is correct. You might have various different correction schedules or correction regimens. When a patient comes to you and you see something, and the patient is referred to you from another doctor. So there was some plan, there was some path in mind though they can be different. My plan can be different because of aesthetic reasons or because of some approach reasons or something else, but that is absolutely normal. Well, being the person who stays far away from your field, actually, I must reassure you, you are doing a huge piece of work. You are like true magicians. You know, it's like a magician in the movie. You have magicians in the movies, but you are the true magicians because you really provide people with actual beauty by means of some magic manipulations. Okay, colleagues, let's go on. And this is my true pleasure now to give the floor to a physician, dermatologist, cosmetologist, the HYALUAL international trainer. Here, you can start uploading, by the way. We have now Natalia Makisha with us. Hello, colleagues. Good day. We're from Ukraine. Welcome, everyone. Thank you very much for being with us offline. And also, thank you very much for being with us online, dear colleagues. I am extremely grateful that you found a chance and opportunity to be with us today, and you also have enough possibilities and time to stay with us. I'm also grateful to the HYALUAL company. Many other colleagues have already thanked the HYALUAL company, but under given conditions, I think it is never enough to say thank you. The new Ukrainian nation is getting reborn. Therefore, we need to thank each other. We need to thank one another. We need to thank the colleagues, and we need to thank the HYALUAL company. Thank you very much, dear business colleagues, for finding opportunities to fund the project, to support the project. I'm grateful for supporting it both online and offline. So, speaking about my clinical cases now. Case number one. It was about 2.5 months ago when a patient presented to me with the claims. She said she had some red spots on her face. The skin was very sensitive. She said it was observed periodically before, but before the skin was not that very dry as it is now. She does not consume alcohol. She is here. We can see the evident symptoms of cuperosis in the mid part of the face. Pay attention to the mimic wrinkles in the periorbital area and also in the lower part of the face that had to be mimic ones. During palpation, we found the skin definitely lost the turgor and the elasticity, and it was pretty dry, I must say. So the diagnosis was cuperosis, the deformation swelling type of aging, phototype 2 by Fitzpatrick. That is important to reason the suggested treatment techniques to the patient. So what has been done? The first procedure was redermalization with the use of HYALUAL light 1.1 2 milliliters. We used the popular technique for skin and face. 7 days after, we performed the photodynamic procedure with the Levoderm gel. The exposition of gel was 30 minutes. LED light was 10 minutes. After the procedure, the recommendations, just common standing recommendations were provided to the patient, and it was using the SPF 50 plus cream. And 14 days after, we performed the same redermalization procedure with the same HYALUAL light product. I like using that for rosacea, cuperosis patients, and that really turned to be a very effective approach in this patient. So these are the results. These are the outcomes that we have in the patient. Give me a second.
What did I do wrong? Just a minute. Yes, everything's going to be all right. Can I get my slide back? So it just shows you that everything is live and things like that happen. Oh, yes, thank you. So what I would like to say, what did we get? We got a good result already because dryness of face complaints disappeared, cuperosis regression by 90%, and speaking about the marked wrinkles, regression is almost 50%. And look at the oval of the face. It's very clear cut, and that means a very good correction of edematous type of aging or deformation edematous type of aging. Now she looks younger, and now she gets a lot of compliments, regardless of the fact that the war is ongoing, but it's very inspiring when the patients are really satisfied. Speaking about dry skin, so we've corrected dry skin problem, which is really important because skin dryness is the mostly widespread problem that dermatologists face in their practice. Each fifth patient has complaints of dry skin. And why is that? Zaporizhzhia is 20 kilometers now away from the hostilities, from the military activities. And we provide care to patients with dermatological problems on it every day. And the most frequent complaint is dry skin, regardless of the age. In young patients, too. And dry skin is not just dry skin, it's like cirrhosis, skin sclerosis. You look at skin, and I respect skin because I'm a dermatologist, and sometimes my heart breaks when I see a skin like that. So having the opportunity to do something about that problem is really worthwhile. I just want to explain why I provided this care. Mechanism of action. With regards to photodynamic therapy, probably you might ask why I chose this method. Why PTD? I've been working with with PTD for about 3 years. Lots of procedures have been done before the war, so I can use it as monotherapy and in combination with other methods. With regards to leveling acid use, so this use has a level of evidence 1A. What is the mechanism of action here? And why photorejuvenation happens and cuperosis correction? Because MMP's type 3 increases, and that allows to degrade and to eliminate the damaged collagen. So this provides photorejuvenation. And the decrease in telangiectases is related to the fact that new collagen develops in the papillary dermis, and it goes to deeper dermis, and that might lead to vascular changes. I can talk about photodynamic therapy a lot, so here I just explain why I chose that in that patient. And patients with dry skin, I usually recommended this method. So these are the results of sonography, because the picture might not always show the quality of skin that we are receiving. And in my daily practice, I really admire those methods that improve the skin quality the best. When we talk to people, we pay attention to skin quality, because if it has quality, it looks very well groomed, looked after, and it's really much, much more pleasant to communicate with a person with such a skin. Also, please pay attention with regards to photodynamics and the thickness of the papillary dermis and reticular dermis. The thickness has changed almost twofold. What does it mean? And it means that papillary dermis equals skin quality. It's well-humidified skin, it's cuperosis correction, it's regeneration potential of the skin. It's a very good preparation to any traumatizing procedures, because the skin has this potential to regenerate. With regards to reticular dermis, here increase almost twofold that we see. And also I need to mention that before the war, on a different lamp, we had results up to 300% of collagen increase is something that we saw. It's kind of a non-surgical lifting that our patients expect from us, and they get it from us. Why redermalization? I just adore redermalization starting from 2009. I just love it, no complaints. So every day I thank company, just 2 components, but we get such wonderful results. So thank you. It's HA, high molecular weight, and then just the sodium succinate, but the results are perfect. Why we chose that? Because of copperosis, and we know that succinic acid has a very good angiogenic activity, and Yulia Tkachuk has talked about that when she showed the rosacea patient. It leads to stimulation of secretion of VEGF, and there is an ability to correct the vessel diameter, so it's true. And cytoprotection as well. So back in 2011, we were told no, don't touch patients for rosacea. So we had always very good results, particularly in such patients. So I love this method. I respect this. I adore this method. Even more to say, when patients and when you offer something else to a patient, which is HA based, they say, well, get me back on HYALUAL because I just love it. This remission on skin humidification is received only with hyaluronic acid plus succinate, and I thank succinate for being part of my practice. Speaking about another case, 2 months ago, a client came to us complaining of the problems on his right side of the face, inflammation, pain. We can see it's a thermal burn, grade 2, and type 2 Fitzpatrick scale. So what did we do? The first procedure is photodynamic therapy with levoderm gel. It was done day 3 after trauma. Exposure of the gel was 30 minutes, lead 10 minutes. And also we recommended 100% protection from UV light. That is really important. In 14 days, the patient received redermalization with HYALUAL light, 2 milliliters, concentration 1.1, so 11 milligram HA, 16 succinate. The same concentration in all our products, just to remind you. So we received quite a good result, and the patient was really satisfied. And his wife also came to us before, and he couldn't understand what she spends his money for. But now on him, he understood what cosmetology does to patients. So you can see him on the right side and the left side of his face as well. And you can see there is no difference in skin quality, the damaged part and undamaged part. And I believe such results, they inspire us and they make us be sure in the tomorrow day. So whatever patients come to us, we have instruments and we have actionable instruments and techniques. It's not just a marketing thing. So I use the PDT, as I mentioned. So why I used it? To prevent infection and for quicker regeneration. Why that happens? And there are lots of trials showing that. 945 trials that you can see on this levulinic acid. It's been studied extensively. So what this bactericidal and bacteriostatic action of levulinic acid due to quick regeneration of photochemical reaction, quick generation of singlet oxygen, and it has very good anti-tumor immunocorrection, anti-bacteriostatic bacteriocytic and static, and it pertains with regards to gram-positive and negative organisms that it's active. And today we talked about the relevance of E. coli, enteric agent, and for patients, for people who are in shelters for a long time with dermatosis, it's very relevant. So this 5-deoxyribonucleic acid has bactericidal effects as well towards E. coli and towards other agents like yeast-like fungi. It allows us to work with a lot of dermatosis, including different forms of acne. 5-ALA also affects on necrotic phase of wound processes and activate granulation process, which is really important for healing, wound healing. Besides, there are lots of data that PDT with 5-ALA to autodermoplasty reduces the time of preparing the patients to autodermoplasty. And we've seen cases from Sergei Drobak and others, and we saw that it's not the first number one correction, aesthetic correction, but still this is something what our patients are going to come to with the war, when the war ends, when they get into cosmetic correction. Why succinate? We can talk a lot about the succinate. It's very well studied substance. Succinate has the opportunity, the ability to provide very potent anti-inflammatory effect due to the following. M1 macrophage switch to M2 macrophages, and M2 macrophages are the ones that produce anti-inflammatory cytokines. So that is why I love the redermalization procedure in patients with multiple dermatosis, different dermatosis. They respond really well. All right, I would like to thank you for your attention. I also would like to say that yes, we can do volumizing, face volumization. We can work on asymmetry, but psychological aspects leads to dry skin. We know that, and dry skin, it's quicker aging, chrono-aging. So we shouldn't forget and offer our patients to correct their dry skin. And in my day-to-day routine, I can see that lots of dermatoses are quite malignant in patients, not in terms of cancer, but their course is not good. And these dermatoses can be very and manifest very atypically. So you have to really think about what to do the best for each particular patient, because you want to help as much as possible. I wish you quick victory with good young skin, high quality skin, and also to all our colleagues abroad, what I would like to say, I wish you to never hear the words that the war has started in your country. Thank you for your attention. And we thank you. Dear friends, if you have questions from the audience, if no questions, there are more questions from chat. We will not let you go just like that. Are there any questions from here? Then the chat, the question from chat. Do you recommend a PDT in acne, and why PDT and HYALUAL are combined? And what kind of methods of PDT do you combine with? Okay, thank you. I would like to say, with regards to the acne, it's a very good method of correction, regardless of the severity of the process, of the course. Lots of methods should be done, of correction should be done when the inflammation subsides. But here we can do something even in the active phase of inflammation in acne. And with regards to bactericidal and bacteriostatic effect 5 aminolevulinic acid is very active against different bacteria, so I do that every day. And also there was a question, what kind of methods do you combine with? Practically with anything that I have in my armamentarium, RF, laser and others, but in order for me to be sure with regards to reparation of skin, the first procedure is going to be PDT. I will get the skin prepared. I will kind of inspire the skin, give it the opportunity to regenerate. And later on, I will do something else. And then I will work on reduction, on lifting, whatever. So the first procedure is the one I mentioned. But in general, I would like to say that it's wonderful that two simple methods, not expensive methods, which is redermalization and PDT, provides us wonderful and very well manifested results. And I will use them, and I wish you use them too in your practice. Thank you, Natalia, and thank you for your recommendations and answers. Please sit down. Dear friends, we have a good information to all of our viewers and to our experts. HYALUAL has started and launched a charitable project. So your patients can get highly qualified aesthetic restoration after traumas that they have had, and more than 100 doctors already are part of that project. And HYALUAL provides products for the treatment of such patients, and in order to overcome all the evil that has touched them. And our stories are going to be victorious always. Please get involved into that project, so beauty will win, and HYALUAL will help in that. And in order to do that, please refer to your local manager or write in direct on the HYALUAL web page. This information is really important, and I believe it will help lots of your patients, at least some of them. So please write. And it's our pleasure to invite the next speaker, dermatologist, cosmetologist, national HYALUAL trainer, Антоніна Глазепа. Hello, I'm happy to welcome everyone here and all online colleagues. It's my pleasure and happiness to meet now, at least because it's been a very difficult period of our lives. And during lunchtime, when we communicated, I realized that there is no person not affected by war. Everyone was affected, all our friends, family, and people that we know. But it's wonderful that we have this opportunity to get together and share experience and communicate live and online as well. So I talk about complex aesthetic correction today, but also it's related to the recent events. In my clinic, a woman came to my clinic. She wanted, well, to get a job. A good woman. She's a masseuse with a very good experience, good results of work. And in the process, I just realized she is very tired. No wonder, like not a surprise. She lives in Ivano-Frankivsk for 1.5 months, but she is from Belozerka, not far from Chornobayevka. Her parents are still there. And you understand, you realize that the person, there is no happiness, there's no sparkle in her eyes. 3 children, she used to have a good family. She was working and they all had to flee to nowhere. And when you hear such stories, you cannot, you get tears in your eyes. You cannot hold your tears. I'm very empathic. And well, I offered her, maybe I will refresh you, I will improve your mood in order for you to feel better. Well, of course, yes, her complaints, atonic dry skin and just a tired face. And the best in this case is to do the comprehensive correction. We cannot just take one method to use it and get wow effect for all layers of our skin. And we know it's not 2D, but 3D.
It has its composition, and by means of influencing all the layers, you can get the better results. So what was the correction plan? Definitely the botulinum therapy, some chemical peelings, contraplastics, redermalization, and nanohealing. I'm going to show you the intermediate results that we got. We still continue this process, and we think it's going to be better. The first we did was botulotoxin. Probolotoxin was used, Nabota product. I was afraid of swelling, so we used only the lateral part of the orbicular part, so it could be, it was still visible in the beginning. On the 5th day of injection, we see the micro relief was much better. Only one procedure of chemical peeling was conducted here. I love chemical peelings. I keep using that in my daily practice. Why I like the HYALUAL peelings most? They're quite comprehensive. They have lots of different acids. You can choose whatever you want. Gel form is very convenient for use. So it doesn't flow anywhere. Let's say if the patient winks an eye or something, or moves, you get some great result without unwanted long-term rehabilitation. And the skin peeling is very minor, and it allows you really to ensure proper skin relief. Once we are done with the first peeling and we are done with the botulinum, we see that the face looks much fresher. The color of skin is pretty different, and actually the eyesight, the vision of itself is changed in the person. We have been talking about succinate quite a lot today, so I don't want to add much to that. But let me say, I see a very good result while using the redermalizing products based on the succinate acid among patients with higher glycation of proteins. Let's say metabolic syndrome, increased level of glucose in blood, compensated stage. No worries, I have some good practical clinical cases to share. You're going to have my contact details, and I'm open to share all the experiences associated with that. So I used the HYALUAL Light. That was the first redermalization. We didn't want specular redermalization in the patient. So it was just to test the procedure for the first time in the patient, so to say. We got a synergetic effect. We know that the succinate effect is very good, and hyaluronic acid has got a very good effect by itself as well. But when you combine it, the synergetic effect is about 2 times better. I keep explaining it to my patients the following way. It's like your skin is a mattress. You see different layers of it, the outer layer, the internal layer, and the soft part inside. So by means of peeling, you can correct some superficial structures, but if you want to go deep, you can stimulate the collagen production. Hyaluronic acid and redermalizers can be used to go deeper into this mattress, thus leveling your skin, making better volume, and I would say 90% of your patients have a claim saying that, well, the skin is too dry, so it helps when you take that approach. Alexa is one of my best most favorite products. If you remember that safety is top priority, 1/3 of all complications depends very much on the quality of product. Remember that when you come across, when you go on internet and you see lots of different products being so cheap, you can't realize how technically that could be possible. I'm quite afraid of these products, and I will never use something for my patients which I would not allow for myself. And I know the BDD is the minimum number of particles, less than 1 per million. We know that the concentration is absolutely fine and good. We know how it can be forecasted, we know how it works, and you can definitely how to prognose your result. You know what you use. Definitely 1/3 depends on the hands of the specialist who injects the patient. And the last third depends on the patient, him or herself, because you never know exactly how the organism responds, what autoimmune conditions might be there. And that is not about the disease, it's not about the procedure, let's say. You just never know how it goes. 1/3 of this component is, independent of you, but the 2/3 are quite dependent, and they stay in your hands. That is why we use the high-level products only. I used cannula for this patient, and the needle was used only for the lip contour. The correction scheme looked as follows. Let me explain it now. So we see here a certain deficit in the mid-third of the face. We see this problem here in the cheek. We can't impact pathogenesis of aging with fillers, but we can change visually a much fresher effect to the face. 1.5 milliliter of filler volume was used. The medium could be used. Volume really made it a great contour for the lips. 1.15 was used here, close to the piriform foramen, just to lift and it up just a bit and cosmetically remove these shades. And nanohealing is still in plan, is still waiting. I'm using some other popular techniques as well, but I also use Perfoskin as a complex approach, and you never know what is a better response in a patient. Sometimes you think like, well, redermalization is fine, and you get a good result, and then you perform one more nanohealing procedure, and the patient tells you, wow, I finally see the result. So the more techniques you use, the better result you might have, because you stimulate different mechanisms of impact. This is the result. 1.5 weeks after. So botulotoxin, fillers, and the best gratitude from our patients is happiness in their eyes when the patient smiles to herself into the mirror and gives you a hug. This is something that can't be, explained. So we continue our efforts in our front, and we believe in the armed forces of Ukraine. Thank you very much. Thank you very much for your job. Thank you very much for your understanding practices and sharing your best results with us. And thank you very much. Dear colleagues, do we have questions, please? Thank you very much indeed. Colleagues, ladies and gentlemen, the final presentation for today and the final speaker, Dr. Dermatologist, the international trainer for HYALUAL. As far as I know, we already have Denis Lebedev with us, a dermatology doctor, cosmetologist, and the national trainer of HYALUAL. Well, Denis, we can see you. We would like to hear you as well. Welcome. Welcome, dear colleagues. That's my true pleasure to hear you. I have been watching and listening to the presentations from my colleagues, and that was really much fun for me and much pleasure. So let's continue. My today's topic is the rehabilitation and assisting rehabilitation after the CO2 grinding. So basically, we want to reduce the rehabilitation period. How to do that? As you know, the CO2 laser is one of the most common and popular procedures for anti-age medicine treatment. CO2 laser is using the wave 10.600 nanometers. It evaporates water from epidermis cells and creates a so-called ablation wells. So these are like columns or pillars in the epidermis that stimulates collagen synthesis and allows you to treat the hyperpigmentation. And this is especially true for collagens of type 1 and 3. Though you can cover not more than 25% of skin during the procedure. That is why they call this laser approach to be fractional. So basically you treat a part of skin. This is different from the first lasers that would irradiate a large amount of skin, the large surface, and that could lead to unwanted consequences like long-term rehabilitation period and some unwanted outcomes in the patient. Preparing for CO2 laser. Sorry, give me a second. Please give me a second. So preparing for CO2 laser. That looks pretty simple. Though some mandatory preconditions need to be performed. They're quite simple for the patient. The patient should not take on tan. They need to refuse from systemic retinoids. It is desirable to refuse from oral contraception. And it is advised to take some painkilling before the procedure, 40 to 60 minutes, ketanov, Nimesil, Dexalhin, or any other NSAIDs. Speaking of rehabilitation, rehabilitation looks not complicated at all. These are some really easygoing points to be performed. Gels that facilitate rehabilitation like Cicaplast, Cicalfat. Contacts with water need to be limited. Skin cleaning need to be performed carefully because there is a prolonged thermal burn after the procedure. It is desirable to minimize contact with the UV light for about 6 months period of time. If the procedure took place isolated way in the periorbital area, it is desirable to wear the sunglasses for 3 to 6 months. Topical steroids are allowed, and sometimes even the parenteral administration, like dexamethasone, could be used to remove swelling and painful feelings. Decorative cosmetics needs to be excluded for a short period of time, and some other competitive procedures like peeling or RF lifting, for example, should not be repeated after CO2 laser earlier than 1.5–2 months. Should not be performed. So, speaking of CO2 laser, the action of this approach, even if the patient sticks to the recommendations, pre-procedure and post-procedure still might lead to some certain side effects. The most common would be hyperpigmentation or a prolonged erythema that might also switch into hyperpigmentation with time. That is an unwanted side effect. Patients are not happy with that, and you might get a problematic case in such a situation. Moreover, even those products included into the protocols for post-procedure care, they can also result in some unwanted side effects. such products like Bepanthen might lead to some unwanted dermatological problems like the one we have had on our slide. Therefore, I decided to work upon improvement of the pre-preparatory phase and post-procedure phase using those methods and products which I have at hand and I know well. So I recollected that there is a whole line of redermalization products well known to everyone. That includes, that contains the succinic acid. Would you remember that the succinic acid is a Krebs cycle product that's an intracellular metabolite? It actually improves the microcirculation. It restores the acid-base balance. It actually normalizes the level of pro-inflammatory mediators, and that increases the level of resistance to hypoxia. The succinate also regulates the inflammation process. Let me remind you, the inflammation is a chronic inflammation that is considered to be one of the aging factors, and that is the redermalization, the redermalizants that can switch the macrophages M1, which are pro-inflammatory, and they switch them into macrophages M2, which are capable of synthesizing pro-inflammatory cytokines, reducing by that way the level of mediators, inflammatory mediators. Speaking of hyperpigmentation, there are some very good studies of Professor Maurizio Ceccarelli, for example, and they indicate that the succinic acid is capable of chelating, basically taking the cuprum ions from tyrosinase, and basically that blocks the fermentation function, blocking the fermentation activity. Therefore, as we realize this double type action of the succinate acid and hyaluronic acid, they're both capable of reducing the level of inflammation. For example, they activate the macrophages. I'm talking about HA now. They can stimulate the process of phagocytosis. And speaking of sodium succinate, it has a specific alignment with cuprum, blocks the tyrosinase activity, and blocks the biosynthesis of the new melanin as it goes here. So, by means of this dual effect, theoretically, even before the use of redermalizing products, I realized that the process of redermalization can significantly improve the rehabilitation in patients. So, before trying that on my patients, I decided to pilot that on myself. So this is my hand. I performed an experiment like that on a small section of my skin with the use of popular intradermal injection. I used HYALUAL light, sorry. That was HYALUAL 1.1%. 1 week after, I conducted the CO2 laser on the symmetrical sides of my forearm, using it as a control site. So what I got is as follows. So in the area where I had the redermalizing agent injected, I got a very light response to the laser. I didn't have any post effects like burn or itching, but if you look into the control, side, you see I have had a rather marked erythema, and my feelings were, I would say, less comfortable. After that, I decided to perform these pre and post procedure preparation on my patients. So, to perform the experiment at a higher quality level, I decided to prepare those patients who had indications for a deep CO2 laser use. These are conducted under sedation conditions because of very painful procedure. That is a rather traumatic procedure, I would say. So I was very much interested in improving the post-procedure rehabilitation in my patients. That given patient, being 48, was conducted with 2 procedures of redermalization using HYALUAL 1.1, HYALUAL light. 2 procedures with a difference in time of only 1 week. Speaking about deep CO2 laser, that requires classical rehabilitation for about 2 to 3 months period of time. So all these signs, all these parts of dead skin on the face, they usually come off, usually in 2-3 weeks. But now, in just 6 days, we see that the patient has its face clear, just a minor erythema, and after a couple of weeks, we see the following situation. We see a minor erythema in the patient only. That's fine, by the way. If we did not do this preparatory procedure, the erythema would be much bigger, much higher severity. And it is quite okay in this case if the erythema stays for about half a year period of time under normal conditions. So in my situation, I think the experiment went very well. I have had another patient. This is a younger lady. She's 32. She also had indications for a deep CO2 laser. We've been making photos on a daily basis. So there is a photo before, right after, the first hour, the next day, and you see 1, 2, 3, 4, 5 days. The redermalization process took the same regimen. 2 procedures, preparatory procedures were performed before the CO2 laser was applied, and that is the result that we got. 2 weeks after, the skin was absolutely clean, just minor erythema was observed, and the patient was absolutely happy, I would say. Let me also tell you that redermalization, that is the redermalization that in my patients significantly improved the post-procedural period, improved the situation with the side effects in the form of hyperpigmentation, erythema. Redermalization could be seen not only in the context of CO2 laser application, but also in the case of using some other techniques, like preparing the patient for some traumatic interventions, pre-surgical preparation, post-surgical interventions. So it could be used quite widely. And the purpose of redermalization is to reduce the rehabilitation period. After any procedure, the level of heterotropic potential of skin is increased multiple times after this preparation. So when you prepare it with PRP, this is one situation, but for redermalization, I got really some significant results, which looked very good to me and to my patients as well. Thank you. Well, this is it from my side, basically. Do you have any questions? Well, I actually can see and hear a whole round of applause to you. Did you hear it? Let's hear it again. Okay, and now I suggest we go to the questions. Hello. Sorry, microphone is not working. Sorry, can't hear you. Could you please repeat your question? I want to ask you, if one can use a CO2 laser for keloid scars, do you think it is efficient, or you should use the chemical peelings? Speaking about keloid scars, that is a bit different condition. If you saw my patients, these are normotrophic patients, so to say. Keloid scars is a bit different condition. That includes a certain autoimmune component in it, and I would not use that CO2 laser approach. I would prepare keloids for therapy by means of intensive impulse, IPL basically, and also injection of corticosteroids. That looks like a more promising for easily forecasted therapy. If you use CO2 laser for keloids, that might lead to enlargement of a scar like that. So this idea, I would say, doesn't look good, doesn't look very good, and it's not very welcome to be included into the protocol. Well, we have a question from chat. Maybe. Do we have questions from chats if we don't have in the audience? What parameters of CO2 were used for these given clinical cases? Could you give any parameters? Yes. That was a classical CO2 laser. The parameters were, well, speaking about my experiment I conducted on my skin and my hands. It was something like 18 millijoule. That was the energy of the pulse. It's a minor one. Speaking about patients, could you please repeat the figure, because we didn't hear it well. So it was in the first case with my hand 18 millijoule. That was the pulse energy. Speaking about the clinical cases of my patients, which I demonstrated to you, that was 50 millijoule. So that was a rather dense fractional net, and there were some peculiarities like mechanical removal of skin. Additionally to laser, there were some manipulations performed that allow you to remove just a bit more epidermis. So it was basically a greater capacity used and additional manipulations. This is why I was thinking about ways to improve the rehabilitation. One more question. Is redermalization possible to use after complications following trauma or problems after other types of laser? Well, we can speak about other approaches with the use of light, like IPL, for example. Hyperpigmentation might be a complication after IPL. If you look into some clinical cases from well-known reference books like Springfield, you might come across some burn-associated deformities. And I think you can help the patient to get rehabilitated quicker after that. Non-ablation lasers, ergo, something else. So basically, any case that has some thermal activity, even the micro needle RF, the common RF, redermalization has got good potential for rehabilitation in these cases. Denise, thank you very much for that.
Dear Dennis, thank you so much that you found time to be with us and remotely due to the modern technologies. Thank you very much. So this round of applause is for you. Thank you very much. See you next time. I was happy to see everyone, to hear everyone. And I wish everyone the victory, to get the victory as soon as possible. Yes, yes, on all fronts, that's true. And the only thing that I would like to remind of that the HYALUAL has launched a big charitable project, and your patients might get a highly qualified reconstruction and support after traumas and injuries. More than 100 doctors were involved in that project. Free of charge, HYALUAL provides their products for aesthetic reconstruction, rehabilitation of their patients, patients who suffer due to war. So our stories are going to be 100% victorious. So beauty will win, HYALUAL will win. For details and for participation in this charitable project, please refer to your local manager, or you can write in direct on HYALUAL webpage. Thank you really very much. Thank you all speakers who have joined us and those who are here, those who were online. Thank you, dear speakers here in this audience. Thank you for your work. You make wonders. It's a miracle. Without you, it's not possible to live in this modern world. And I will give a round of applause to you personally. Thank you, dear viewers, participants, and finally offline has starting to emerge after the COVID pandemic. It's a kind of a new level, at least a little bit, but still we have this opportunity to communicate, to exchange our energy. Thank you really very much, dear participants, dear viewers, everyone who have asked their questions. Just to remind you that you can share your impressions, whether you liked it or not, hopefully you did. Well, any your comment and feedback, please write in Facebook or Instagram in your comments and tag HYALUAL webpage as well there. Please be in contact with us all the time, suggest the topics for next discussion. It's important to keep in touch all the time. So thank you for being with us all the time. Thank you for being participatory. Thank you for asking questions. Again, different countries have joined us today. Subtitles are going to be available after this broadcast. If you have not understood everything in Ukrainian, you will be able to review that with subtitles, and then you'll be able to do the discussions in chat. Hopefully soon we will meet again. I wish all of us victory and see you again at new HYALUAL projects.